Welcome to the April 13th, 2023 Enforcement and Compounding Committee meeting. My name is Maria Serpa, chairperson of the committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted in person and consistent with the, it's not in person, it's being consistent with the provisions of Government Code 11133. Participants watching the webcast only will be able to observe the meeting. Anyone interested in participating in the meeting must be joined via WebEx. Information and instructions are posted at our website. As I facilitate this meeting, I will announce when we are accepting public comment. I've advised the meeting moderator to allot 3 minutes to each individual providing comments. This approach is necessary to facilitate this meeting and ensure the committee has appropriate opportunity to complete its necessary business. I'd like to ask staff moderating the meeting to provide general instructions to members of the public participating via WebEx.
Thank you, Madam Chair. Before we get started, I would like to remind board members and senior staff who are not speaking to mute their microphone. If I detect background noise during the meeting as a result of unmuted microphones, I will interject with a brief, friendly reminder or simply mute the microphones. To facilitate public comment, we will be utilizing the WebEx question and answer feature, also referred to as a Q&A panel. When the chair reaches a point in the agenda at which public comment is appropriate, public comment will be requested. At the chair's direction, I will turn on and announce the opening of the Q&A feature. It is not necessary to identify yourself in order to make a public comment. I will take comments in the order they are received. I will give the member of the public the ability to unmute himself or herself. The member of the public will have 3 minutes to make their comment. I will provide a 10-second time warning at the conclusion, the microphone will be muted and we will move on to the next member of the public who has a comment. Please note that the Q&A feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. Once given permission to unmute, the member of the public may unmute themselves and verbally state their comment. The Q&A feature is not to be used for typing out questions or for the committee members to communicate with one another. And with that, I return the floor back to you, Madam Chair.
Thanks, Tricia. I'd like now to take a roll call to establish a quorum. Members, as I call your name, remember to unmute yourself. Jig Patel. Jig's not able to join us today. Renee Barker.
Licensee member present.
Thank you. Indira Cameron Banks.
Public member present.
Thank you. Sung Oh.
I'm here, licensee member.
Thank you. Good morning. Ricardo Sanchez.
Here, public member.
Great. Thank you. Welcome. A quorum has been established. Members, as we begin today, I'd like to thank all of you and the members of the public for your time and participation. As everyone participating today, I ask everyone participating today to be respectful of the work before the committee. We encourage participation by members of the public throughout the meeting at appropriate times. The committee respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the board conducts its business. As included on the agenda today, the committee will focus its efforts on Chapter 800 relating to hazardous drugs handling in healthcare settings, and discussion of the board's current regulations and evaluation on what, if any, changes are appropriate to ensure consumer protection. This will be discussed more in detail as we begin agenda item 5. Let's move on to agenda item 2, public comment for items not on the agenda. We'll begin today with public comment for items not on the agenda. I'd like to remind members of the public you're not required to identify yourself, but may do so. I'd like to remind everyone that the committee cannot take action on these items except to decide whether to place them on a future agenda. Members, following public comment, I will ask you if any items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, but rather opportunities for members of the committee and members of the public to request consideration of items for future placement on the agenda, at which time discussion will occur. Moderator, we're ready for public item.
Thank you, Madam Chair. I've opened up the question and answer panel. If any member of the public would like to make a comment for items not on the agenda or future agenda items, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We will give you a moment. All right, I do see a raised hand, Joe Grazella. And Joe, just a reminder, you'll have 3 minutes. I'll give you a 10-second warning. And Joe, you should be able to unmute yourself. All right, Joe Grazella, you should see a prompt to unmute yourself. Go ahead and click on that. There you go. You're unmuted, Joe.
There. Is it unmuted?
Yes, we can hear you.
Okay, good morning. Considering all the new laws for compounding and only pharmacies that are being inspected are the sterile compounding pharmacies, I would suggest that ACHC do the inspections for all non-sterile CA compounding pharmacies and all of the out-of-state 503A compounding pharmacies. We estimate 40% of all compounds come in from out-of-state pharmacies and are never inspected at all. And the California non-sterile pharmacies are only inspected once every 5 years. As you know, there's a lot of complicated laws here, and they really need to be inspected, not just the sterile compounding pharmacies. If the Board of Pharmacy would ask, do you compound non-sterile and sterile pharmacy medications when applying for a pharmacy license renewal, you can have them inspected out of state, all the out of state and in-state pharmacies as they check it off. This would be a minimal to no cost for the Board of Pharmacy, and ACHC does a good 2 to 3 day inspection that can be reported back to the California Board of Pharmacy. Many states are now requiring this. It's very common, and it's kind of a weak spot here in California where the Board of Pharmacy does not inspect many, probably as much as 90% of the compounds that are made in and are for the patients in California. So this would give you an opportunity to provide inspections, especially for the out-of-state compounding pharmacies. Thank you.
Thank you.
All right, this is the moderator. I see no further requests for public comment. Shall I close the Q&A panel?
Yes, thank you, Tricia.
You're welcome.
Members, having received public comment, I'd like to survey to determine if you'd like to include any item on a future agenda. Okay, moving on to agenda item 3, approval of the March 23rd committee meeting minutes. Included in attachment 1 of the meeting materials is draft minutes of the committee's March 23rd, 2023 meeting. Members, do you have any questions or comments on the draft minutes? As a part of the comments, I would also entertain a motion if you believe such action is appropriate.
Dr. Serpa, hi, this is Eileen Smiley. I just wanted to note one correction. I'm listed that I was present at that meeting and I was not present, but I think Noreen Marks might have been. So that's a change we may have to make.
Thank you. We'll take you off the attendees. I don't believe anybody else should be added. But that would be part of a motion if someone would like to make a motion to include that.
Hey, Chair Serpa, I'm more than happy to make a motion, including Eileen's comments.
Thank you. Do we have a second?
I can second that.
Thanks, Renee. Motion and second on the floor. I'll now open the discussion for public comment on the motion related to the draft minutes. Moderator, please open the lines.
Thank you, Madam Chair. I've opened up the Q&A panel. If any member of the public would like to make a comment on agenda item 3, please type comment using the field in the lower right-hand corner of the screen, or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Yes, thank you.
You're welcome.
With a motion and second and public comment received, I'll now take the roll call vote. Renee Barker,
Yes.
Indira Cameron Banks,
Yes.
Sung Oh,
Yes.
Ricardo Sanchez, Ricardo, I think you're on mute. I see Ricardo's still on mute, but perhaps he's having a technological issue. And so I will just move on. The chair votes yes, motion passes. Agenda item 4, presentation on USP General Chapter 800 regarding hazardous drugs handling in healthcare settings. Before we begin our discussion on possible changes to the board's current regulations on hazardous drugs, we will receive a presentation from Supervising Inspector Anna Kalantar on USP Chapter 800 related to the handling of hazardous drugs. The provisions of this chapter become compendial on November 1st, 2023. Attachment 2 of the meeting materials include the presentation slides. USP has FAQs also available. A link to the information is included in the meeting materials. Good morning, Dr. Kalantar, are you there?
Yes, I'm here. Thank you.
Good morning, Anna. We're ready for your presentation.
All right. Hello, everybody. So we will be doing a presentation on Chapter 800 titled Hazardous Drugs Handling in Healthcare Setting, which will become compendial together with Chapter 795 and 797 on November 1st, 2023. Next, please. This is a disclaimer. I'm not going to read through it. It's here for your information. Next, please. All right, so here we have the overview of the sections in the chapter. Sections 1 through 9 are listed on this slide. Next, please. And then sections 10 through 18 are listed here. We're going to go over the sections that are listed on the slides. Next, please. Okay, so section number 1, titled Introduction and Scope. Basically, this chapter describes practice and quality standards for handling hazardous drugs, HDs, to promote patient safety, worker safety, and environmental protection. Handling HDs includes, but is not limited to, receipt, storage, compounding, dispensing, administration, and disposal of sterile and non-sterile products and preparations. And the chapter applies to all healthcare personnel who handle HD preparations. Next, please. Okay, so entities that handle HDs must incorporate the standards in this chapter into their occupational safety plan, which must at a minimum include the following: a list of HDs, their facility and engineering controls, the list of their competent personnel, their safe work practices, the use of proper PPE, and policies for HD waste segregation and disposal. Next, please. All right, so this is section number 2, list of hazardous drugs. So National Institute for Occupational Safety and Health, abbreviated NIOSH, maintains a list of antineoplastic and other HDs used in healthcare. For the purposes of this chapter, the term antineoplastic only refers to antineoplastic drugs included in Table 1 of the most current NIOSH list. All entities must maintain a list of HDs, which must include any items on the current NIOSH list that the entity handles. This list must be reviewed every 12 months, and whenever a new agent or a dosage form is used or added, it should be reviewed against the list. Next, please. All right, just the next few slides are about the NIOSH. I'll quickly just give a quick overview. So NIOSH is a division of Center for Disease Control and Prevention. and it maintains a list of antineoplastic and other hazardous drugs in healthcare settings. The most current list is the 2016 list, and it's titled List of Antineoplastic and Other Hazardous Drugs in Healthcare Settings. That's the most current one that they have published. NIOSH has proposed an updated list in May of 2020 for public comment, but it has not yet become official. Next, please. So HD is a drug identified as hazardous or potentially hazardous by NIOSH. And in order to be classified as HD, it must exhibit one or more of the following 6 characteristics in humans or animals: carcinogenicity, teratogenicity, reproductive toxicity, organ toxicity, genotoxicity, and a new drug that mimics existing HDs in structure or toxicity. Next, please. The next few slides are basically saying what's in the NIOSH. So table 1 is the antineoplastic drugs. Next one. Next slide, please. Table 2 is non-antineoplastic drugs that meet one or more of the NIOSH criteria for hazardous drugs. Table 3, please. Table 3 is non-antineoplastic drugs that primarily have adverse reproductive effects. Next, please. Table 4 are for drugs that were deleted from the previous 2014 NIOSH list, and since the 2016 list has no deletions to report, there's no table 4 here. And table 5 provides general guidance for some of the possible scenarios that may be encountered in healthcare settings where hazardous drugs are handled. Next, please. All right, so this one is section 2, list of hazardous drugs. This box number 1 here called containment requirement, basically the chapter says that drugs on the NIOSH list that must follow the requirements on the chapter are the ones that are any HD APIs and any antineoplastics requiring HD manipulation. So those need to follow the requirements of the chapter. Drugs on the NIOSH list that do not have to follow all the containment requirements of the chapter, if an assessment of risk is performed or implemented, include final dosage forms of compounded HD preparations and conventionally manufactured HD products, including antineoplastic dosage forms that do not require any further manipulation other than counting or repackaging. For dosage forms of other HDs on the NIOSH list, the entity may perform an assessment of risk to determine alternative containment strategies and work practices. Next, please. If an assessment of risk is not performed, all HDs must be handled with all the containment strategies in this chapter. If an assessment of risk is performed, it must be documented what alternative containment strategies will be used. It must be reviewed at least every 12 months, and the review must be documented. And the assessment of risk must, at a minimum, consider the following: the type of HD that will be used, the dosage form, risk of exposure, packaging, and any manipulation that might be required. Next, please. All right, section 3, title types of exposure. There's table 1 here that shows the examples of potential opportunities of exposure based on activity. I'm not going to go through this. It basically shows that there's a lot of opportunities for exposure in some of these environments and activities performed. Next, please. All right, so section number 4, responsibilities of personnel handling hazardous drugs. There's got to be a designated person who is qualified and trained to be responsible for developing and implementing the procedures, overseeing the compliance, ensuring competency of personnel, ensuring environmental controls. This designated person must thoroughly understand rationale for risk prevention policies, risk for themselves and others, risk of non-compliance, and the responsibility to report potentially hazardous situation to the management team. The designated person is responsible for the oversight of monitoring the facility and maintaining reports of testing and sampling performed in facilities and acting on the results. Next, please. All right, this is the largest section of the chapter, I believe, Section 5, Facilities and Engineering Controls. HDs must be handled under conditions that promote patient safety, worker safety, and environmental protection. So signs designating the hazard must be prominently displayed before the entrance to the HD handling areas. Access to areas where HDs are handled must be restricted to authorized personnel to protect persons not involved in HD handling. And designated areas must be available for the following: receipt and unpacking, storage of HDs, non-sterile HD compounding, and sterile HD compounding. Next, please. So this the small subsection here titled Receipt and Unpacking, and the chapter says that anti-neoplastic HDs and all HD APIs must be unpacked in an area that is neutral or negative pressure relative to the surrounding areas. HDs must not be unpacked in sterile compounding areas or positive pressure areas. Next, please. All right, subsection storage. So storage of HDs, they must be stored in a manner to prevent spillage and breakage. They must not be stored on the floor. Anti-neoplastic HDs and all HD APIs must be stored separately from non-HDs, must be stored in an externally ventilated negative pressure room with at least 12 air changes per hour. Non-anti-neoplastic, reproductive risk only, and final dosage forms of anti-neoplastic HDs may be stored with other inventory. Next, please. So the chapter talks about if sterile and non-sterile HDs can be stored together, and it says yes. However, HDs used for non-sterile compounding should not be stored in areas designated for sterile compounding, and that is to minimize traffic flow. Next, please. Subsection 5.3, compounding. So the chapter talks about containment primary engineering controls, abbreviated CPECs, and containment secondary engineering controls, abbreviated CSEC. CPECs, ventilated device to minimize worker and environmental HD exposure, which must operate continuously if it supplies some of the negative pressure in the room or if it's used for sterile compounding. The secondary engineering control is the room where the containment PEC is placed, which must be externally vented, physically separated, have an appropriate air exchanges, and have a negative pressure between 0.01 to 0.03 relative to all adjacent areas. Next, please. Chapter talks about supplemental engineering controls, closed system drug transfer devices, which are used as an additional control to offer additional control and protection. It also talks about in this section that the sink must be available for hand washing, an eye wash station must be readily available, and that all water sources and drains must be located at least 1 meter away from a containment PEC. Next, please. For entities that handle, that compound both non-sterile and sterile HDs. So the chapter says that containment PECs must be placed in separate rooms unless the CPECs used for non-sterile compounding are sufficiently effective that the room can continuously maintain ISO 7 classification throughout the non-sterile compounding activity. If they're in the same room, they must be placed at least 1 meter apart, and particle generating activities must not be performed when sterile compounding is in process. Next, please. For non-sterile compounding, again, the chapter clearly says must follow the standards in 795. It provides table 2 here, which talks about engineering controls for non-sterile compounding. It says that the containment PEC must be externally vented, and the containment SEC, it says externally vented, 12 air changes per hour, and negative pressure. Next, please. Can the containment PEC used for sterile compounding be used for non-sterile HD compounding? The chapter says yes, occasionally, but it must be decontaminated, cleaned, and disinfected before resuming sterile compounding. Next, please. Again, this is a sterile compounding section. It says must follow all the standards in USP 797. Then it gives us this table 3, which summarizes engineering controls for HD compounding. It's all here. It talks about that the PEC must be externally vented. A containment PEC must be containment SEC must be externally vented, and it have appropriate air changes per hour and have negative pressure between 0.1 and 0.01 and 0.03. Next, please. Can a containment PEC used for compounding HDs be used for compounding non-HDs? The chapter says must not be used for the preparation of a non-HD unless a non-HD is placed in a protective outer wrapper during removal from the PEC and it's labeled to require PPE handling precautions. And all associated materials and wrappers should be discarded as HD waste because the preparation and associated materials have potentially been contaminated by exposure to HDs. Next, please. This is an example of some of the types of class 2 BSCs, type A2, type B1, and type B2 used for sterile HD compounding. Next, please. So in the sterile compounding section, again, I went over this very quickly. It's in that table, table number 3, that the clean room must be externally vented, have fixed walls, have minimum of 30 air changes per hour, have air quality of ISO 7 or better, have negative pressure between 0.01 and 0.03. And if the secondary engineering control is an anteroom, it must have fixed walls, again, minimum 30 air changes per hour, positive pressure of at least 0.02, air quality of ISO 7 or better, and a hand washing sink must be placed in the anteroom at least 1 meter from the entrance to the HD buffer room. Next, please. If HD buffer room is entered through the positive pressure non-HD buffer room, the following is also preferred. The chapter says this is not a recommended facility design. Nevertheless, it says the following. Line of demarcation must be defined within the negative pressure buffer room for donning and doffing PPE, and method to transport HDs and HD waste into and out of the negative pressure room must be available. If using a pass-through chamber, negative pressure buffer area, and adjacent space, it must be included in facility certification. Policies and procedures must be available for this, and refrigerator pass-through must not be used. Next, please. Segregated compounding area, containment SCA must have fixed walls, negative pressure between 0.01 and 0.03, 12 air changes per hour, must be externally vented, and hand washing sink must be placed at least 1 meter away from the PEC. Next, please. The chapter talks about containment, supplemental engineering controls, such as closed system drug transfer devices, and how they may limit the potential of generating aerosols during compounding, must not be used as a substitute for a PEC when compounding, should be used when compounding HDs when the dosage form allows, must be used when administering antineoplastic HDs when the dosage form allows, and CSTDs known to be physically or chemically incompatible with a specific HD must not be used for that HD. Next, please. This is just an example of containment supplemental engineering control. Next, please. This is now section 6, titled Environmental Quality and Control. The chapter says that environmental wipe sampling for HD surface residue should be performed routinely, and it should include interior of the PEC and equipment contained in it, the pass-through chambers, surfaces and staging or work areas near PEC, areas adjacent to the PEC, areas immediately outside the HD buffer room or the SCA, and patient administration areas. Common marker HDs that can be assayed include cyclophosphamide, ifosfamide, methotrexate, fluorouracil, and platinum-containing drugs. Next, please. Section number 7, personnel protective equipment. Chapter says that PPE is required for compounding HDs. Chemo gowns, HD head cover, hair cover, shoe cover, and chemotherapy gloves, 2 pairs. The entity must develop SOPs for PPEs based on the risk of exposure and activities performed. And appropriate PPEs must be worn when handling HDs, including receipt, storage, transport, compounding, administration, cleaning, deactivation, decontamination, spill control, and waste disposal. Next, please. All right, so there is a small subsection here about gloves. The gloves must meet American Society for Testing Materials, ASTM standards. D6978 should be worn for handling all HDs, must be powder-free, and must be replaced for must be inspected for physical defects before use. And for sterile compounding, the outer chemotherapy gloves must be sterile, should be changed every 30 minutes, and must be changed when torn, punctured, or contaminated. All right, in a subsection titled gowns, it says they must be disposable and shown to resist permeability by HDs, must be selected.
Did we lose her?
I think Anna was frozen and then dropped off. We'll wait a minute to see if she reconnects.
This is the moderator. I lost her as well, the ability to hear her.
We'll just pause for a moment. Technology is our friend.
Right. She is still logged in. It may just be that she needs to keep her camera turned off to avoid sucking up bandwidth.
Let's take a 5-minute break here because she may not know that she's not connected and maybe just talking to thin air here. So we'll take a 5-minute break and come back at, let's see, at 9:40. We'll take 6 minutes. 9:40. Thank you.
I'm still trying to join, but.
Yes. So Chair Serpa, Anna is trying to connect with her audio through the phone because her computer audio connection's unstable.
Okay, we'll give 1 more minute so then we can continue. I think Anna's doing a great job. It'd be great to be able to continue with her.
Yes.
Yeah, give me 1 second. I should be able to.
You will get feedback when you get connected.
Enter your attendee ID or the numeric meeting password followed by pound.
The numeric password would be which one? The webinar number?
Hey, Maria, I'm back. This is Ricardo.
Hi, Ricardo.
If you guys can hear me this way, I can just
Your entry is
continue because I can continue. If you can hear me, I can continue through the slides because I do have the slides.
Okay. That I can give you the access code for joining by phone and the passcode if you need it.
Whatever is easier. I can continue this way if you hear me.
Yeah, let's continue. I think we're
Okay.
okay for right now.
Yeah,
Okay.
we're good. Okay.
Thank
All
you
right.
for trying.
So the next.
So, just a moment while we get your slide up and take care of that part of the technology. I'll do a quick roll call.
Okay, sure.
Okay, we're coming back, and it'll be just a few minutes before we get back to the presentation. But just to assure everyone's here, Renee Barker. Are you on mute, Renee?
Did you hear me? Present. Back.
Thank you. Indira Cameron Banks,
Present.
Sung Oh,
I'm here.
Ricardo Sanchez. Heard him. I heard you a minute ago, Ricardo. Are you still there? Okay, he said he was here a minute ago, but he must have maybe technological problems. We'll continue. Thank you, everyone, for your patience. You know, as I said, technology is our friend here. It allows us to be comfortable in watching the meeting, but it also causes some challenges sometimes. So thank you, Anna, for being patient with us too.
Sure.
Go ahead and
Can
continue.
you hear me? Because I turned off the video. I think that was, that's helped a little bit. Okay.
Can you see your slides, or are you going to follow along?
I can see the slides. I can see everything. I just turned my video off and that has helped.
Perfect. Thank you. Continue.
All right. So where were we? We talked about gowns. Okay, next slide, please. All right, so for head, hair, shoe, and sleeve covers, the chapter says when compounding HDs, a second pair of shoe covers must be donned before entering the SEC and docked when exiting, and shoe covers worn in HD handling areas must not be worn to other areas. And for eye and face protection, must be worn when there is a risk for spills or splashes of HDs or HD waste materials when working outside of containment PEC. And goggles must be used when eye protection is needed. Next, please. Chapter talks also about respiratory protection and that surgical masks must not be used when respiratory protection is required. And for most activities, a fit-tested, NIOSH certified N95 respirator or more is sufficient to protect against airborne particles. However, they don't provide protection against gases and vapors and lip protection against liquid splashes. Appropriate full face piece chemical cartridge type respirator or powered air purifying respirator should be worn when there's a risk of respiratory exposure to HDs, including when attending a spill, deactivating, decontaminating, and cleaning underneath the work surface of a PEC, and if there is a known or suspected airborne exposure to powders and vapors. Next, please. This is just my pictures of some of the examples, and N95 respirators, powered air purifying respirator, and full face mask with chemical cartridge type respirator. Next, please. Disposal of used PPE. All PPE must be, when worn, must be considered contaminated with at minimum trace quantities of HDs. All PPE worn during compounding is to be disposed in a proper waste container before leaving The containment SEC, chemotherapy gloves and sleeve covers worn during compounding must be carefully removed and discarded immediately into a waste container approved for trace contamination or contaminated waste inside the containment PEC or contained in a sealed bag for discarding outside of the PEC. Please. Section 8, titled Hazard Communication Program. The chapter says that entities are required to establish policies and procedures that ensure worker safety during all aspects of HD handling, and that entities must develop SOPs to ensure effective training regarding proper labeling, transport, storage, disposal of HDs. Elements of the hazard communication program are listed here. I'm not going to go through them, but they're listed here for you, and they come, straight from the chapter. Next, please. Section 9, personnel training. The chapter says all personnel who handle HDs must be trained based on their job functions and must occur before the employee independently handle HDs. Competency must be reassessed at least every 12 months. They must be trained prior to the introduction of a new HD or new equipment and prior to a new or significant change in the process of SOPs. All training and competency assessment must be documented, and the training must include at least the following: overview of all HDs and their risks, review of SOPs, proper use of PPE, proper use of equipment, response to any HD exposure, spill management, and proper disposal of HDs. Next, please. Receiving. So receiving it, HDs should be received from the supplier in an impervious plastic to segregate them from other drugs. Must be delivered to the HD storage area immediately after unpacking. PPE, including chemo gloves, must be worn when unpacking HDs. A spill kit must be available in the receiving areas. The entity must enforce policies that include a tiered approach, starting from visual examination of a container for signs of damage or breakage, and damaged shipped containers should be transported to containment PEC designated for non-sterile compounding. Next, please. This is table number 4, and this section that basically summarizes the requirements for receiving and handling damaged HDs, HD shipping containers. Next, please. Section 11, labeling, packaging, transport, and disposal. So for labeling, HDs must be clearly labeled at all times. Personnel must ensure that labeling process for compounded preparations do not introduce contamination into the non-HD handling areas. For packaging, and must select and use packaging and containers that will provide and maintain physical integrity, stability, and sterility if needed of HDs during transport. Must protect the HDs from damage and contaminating, anything outside of those HD containers. Must have written SOPs to describe appropriate shipping containers. For transport, they must be labeled, stored, and handled in accordance with applicable federal, state, and local regulations. Must be in containers that minimize the risk of breakage and leakage. And must ensure that labels and extra labeling for the HDs include storage instructions, disposal instructions, and HD category information. So, and for disposal, all personnel performing custodial waste removal and cleaning must be appropriately trained for that. Next, please. Dispensing final dosage forms. HDs that do not require any further manipulations other than counting or repackaging of final dosage forms may be prepared for dispensing without any further requirements for containment unless required by the manufacturer or visual indicators of HD exposure hazard are present. Clean equipment should be dedicated for use with HDs and should be decontaminated after every use. And tablet and capsule forms of antineoplastic HDs must not be placed in automated counting or packaging machines. Next, please. So again, for compounding, the chapter says again and again that it must be compliant with appropriate USB standards for compounding, including in 795 and 797. All the compounding must be done in appropriate engineering controls. Bulk containers of liquid and API HDs must be handled carefully to avoid spills, and APIs or other powder HDs must be handled easy to protect against occupational exposure, especially during particle generating activities. Next, please. Section number 4, administering. The chat talks about that it must be administered safely using protective medical devices and techniques, and appropriate PPE must be worn when administering HDs. Equipment such as tubing and needles and packaging materials must be disposed of properly, such as in HD waste containers after administration. CSTDs must be used for administration of antineoplastic HDs when the dosage form allows. And if HD dosage forms do not require manipulation, such as crushing tablets or opening capsules for a single dose, personnel must if they do require manipulation, personnel must don appropriate PPE and use a plastic pouch to contain any dust or particles generated. Next, please. Deactivating, decontaminating, cleaning, and disinfecting. Section number 15. The chapter says all areas where HDs are handled and all reusable equipment and devices must be deactivated, decontaminated, and cleaned. And for sterile compounding, also subsequently disinfected. PMPs for cleaning must include the procedures, agents used, dilutions, frequency, and documentation requirements. And there should be appropriate PPEs resistant to the cleaning agents used, 2 pairs of chemotherapy gloves, impermeable disposable gowns, eye protection and face shields must be there if splashing is likely, and respiratory protection must be used if warranted. Agents used for deactivation, decontamination, cleaning should be applied through the use of wipes that are wetted with appropriate solution, and all disposable materials must be discarded to meet EPA regulations and the entity's policy. And the cleaning must be done in areas that are sufficiently ventilated. Next, please. Okay, so this is table number 5 from the chapter titled Cleaning Steps. It basically describes the cleaning steps, the purpose, and example of agents to be used for a particular cleaning step, whether it's deactivation, decontamination, or cleaning. Next, please. So again, deactivation, it renders a compound inert or inactive. Decontamination and inactivates, neutralizes, or physically removes the HD residue. Cleaning is a process that results in the removal of the contaminant, and disinfection is a process of inhibiting or destroying microorganisms. Next, please. Section 16, spill control. The chapter says all personnel whom must receive proper training in spill management and the use of PPE and NIOSH certified respirators, and spills must be contained and cleaned immediately by qualified personnel with appropriate PPE, and that qualified personnel must be available at all times while HDs are being handled. Signs must be available restricting areas to the spill area. Spill kits must be available. All spill materials must be disposed appropriately. The spill and the circumstances and management of that spill must be documented. There have to have SOPs must be developed on how to prevent spills, on how to clean up the spills, to address the size and the scope of the spill, and who is responsible for spill management and the type of PPE used. And the SOPs must also address the location of spill kits and cleanup materials, as well as the capacity of the spill kit. Next, please. Section 17, documentation and standard operating procedures. The entities must maintain SOPs for handling of HDs in all situations. SOPs must be reviewed and documented, and the review documented at least every 12 months. It's listed here. I'm not going to go through them, but the chapter clearly says the SOPs should include the following, and it's all listed here for you. Personnel who transport, compound, or administer HDs must document their training according to OSHA standards and other applicable laws and regulations. Next, please. And this is the last section of the chapter. It's titled Medical Surveillance, and medical surveillance is part of comprehensive exposure control program, complementing engineering control, safe work practices, and use of PPE. And healthcare workers who handle HDs as a regular part of their job assignment should be enrolled in a medical surveillance program, according to the chapter. And I believe this is the last slide. Yes, thank you.
Thank you, Dr. Kalantar. I just have one question, or I guess maybe for clarity, if we can include in the slides. I think you did an excellent job of explaining everything, but I think if someone were reading the slides, they may misunderstand. Under 532, sterile compounding, in both sections where it talks about negative pressure, I just wanted to make sure that everyone understood when Dr. Kalantar talked about negative pressure between 0.01 and 0.03, that's negative 0.01 and negative 0.03.
Yes.
It does say negative pressure in the sentence, but that's both.
Yes, absolutely. Negative pressure.
So maybe the slides could be updated so people who didn't hear your presentation and just are reading it are not confused by that. But you explained that in your presentation, and I appreciate that.
Thank you.
So members, do you have any questions or comments for Dr. Kalantar? Hearing none, moderator, we're ready for public comment. As a brief reminder, public comment is an opportunity to provide comment on the information presented. It is not a question and answer session. As indicated in the meeting materials, USP does have an FAQ available on its website, and it's a very good resource going over many of the concepts in USP 800. Tricia, I think we're ready for public comment.
Thank you, Madam Chair. I've opened up the Q&A panel. If any member of the public would like to comment on agenda item 4, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We are displaying instructions, and we'll give you a moment. All right, this is a moderator. I see no request for comment at this time. Shall I close the Q&A panel?
Please do, thank you.
You're welcome.
Thank you, Dr. Kalantar, for your presentation. I know that we will have many questions for you as we go on to the next agenda item, so I'm glad that you'll be staying around with us.
All right, thank you. I'll be here.
Thank you. Next agenda item number 5, discussion and consideration of possible action on proposed to add new titles in sections 1737 through 1737.18 to Article 4.7 of Division 17 of Title 16 of the California Code of Regulations related to the handling of hazardous drugs. As we continue our work on the various USP chapters and review of current and proposed regulations that may be necessary to implement, clarify, or to make more specific requirements related to these respective chapters. As I stated in our prior discussions, I believe it's appropriate that any such regulations mirror the structure of the respective chapters. This means that the numbering format and section titles for the proposed regulations will mirror the USP chapter. Just to be clear, our goal is not to reiterate the provisions of federal law or USP language, but to clarify or make more specific the requirements. If no clarification is needed or no additional requirements are necessary for public safety, there is no additional language being proposed. As I stated as a part of my opening remarks, the board is a consumer protection agency. As we consider development of regulations, it will be through the lens of the board's consumer protection mandate, as the law makes clear whenever the protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This is a dynamic process, and individuals will have opportunities to participate throughout the development and rulemaking process. So we will have many meetings and discussions on these regulations. Licensees of the board generally must comply with a myriad of state and federal laws. At times, a licensee may become so focused on the specific section of the law that they forget the larger picture and other provisions of the law that also are relevant. We see this in several areas of pharmacy practice, but it is quite pronounced in compounding. I would also like to remind everyone of the excellent overview that Counsel Eileen Smiley of Section 503A. The live stream of this meeting and the presentation slides are available on the board's website. I encourage individuals interested in this area to watch the live stream recording that is available. It's important to emphasize a few points from that presentation. The committee will not be looking to add regulation requirements already laid out in USP chapters or federal law. The committee is generally focused on detailing additional California state requirements related to the changes in the USP chapters. Also, these discussions will be dealing with the standard for compounding pharmacy and compounding pharmacists operating in compliance with the exemption in Section 503A of the Federal Food, Drug, and Cosmetic Act, and not with 503B or outsourcing facilities. Section 503A is quite extensive, but I feel it's appropriate to highlight that one of the specific conditions a licensee must be eligible for the exemption provided under 503A is that the drug product is compounded in compliance with USP chapters on pharmacy compounding. It's important that members and stakeholders understand that as we begin the discussion today, Business and Professions Code Section 4126.8 explicitly states the board has the authority to enforce any USP chapters where incorporated by reference in pharmacy law and its regulations. The board can also add additional requirements to USP language. It cannot promulgate a lesser standard in its regulation. I note that comments that were received and posted on our website throughout these last few meetings however, I believe that it's appropriate that the comments under our consideration today, as the information is not on the agenda. Let me say that again because it sounded a little confusing. Some comments were received and posted on our website. However, the comments appropriate for our consideration today, so I'm the one who's reading it wrong. I believe the comments appropriate for our consideration during the April board meeting next week, as the information is not on our agenda today. So if that makes sense, we did receive some comments that are not for agenda items that we have today, but those comments will be considered at the general full board meeting next week when we go over all the proposed regulations. With that understanding, unless members have a question, I suggest we begin. As at the last meeting, I intend to discuss each section first as a committee, then ask the moderator to open to public comment. We can refine the language through our discussion with the understanding that any language we amend today will be reviewed by council. Following the end of public comment, I will summarize comments received for each section, and we can determine if additional changes to the proposed language is appropriate. I've requested, and you can see on the screen, that staff display the language during this portion of the meeting to allow edits to be made during the meeting when we believe changes are appropriate. As I previously stated, this is just the beginning of the regulation process. There will be additional opportunities for board and public to consider language and to provide comments. To many of us, these are new concepts that we're going to discuss today. In addition to relying on our own expertise and understanding, supervising inspectors Palantar and Acosta are available to assist us where we require technical input. Okay, we're about to begin our fourth section of USP. Members, do you have any questions on the process before we begin? And members, sometimes I can't see you, so if you raise your hand, please speak up too. Okay, let us begin. The first proposed change you will note is proposed section 1737 includes providing the proposed article 4.7 handling of hazardous drugs to include standards established in USP 800. The language also provides a cross-reference to other articles relating to non-sterile and sterile compounding. The cross-reference serves as a reminder to licensees that where appropriate, consideration of other requirements may be appropriate depending upon the activities being performed. Members, do you have any questions or comments on this first section, 1737?
No.
Okay, let's open up for public comment, 1737.
Thank you, Madam Chair. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Thank you, yes. Moving on to section 1737.1, introduction and scope. The proposed language in this section establishes a requirement to ensure that as a part of the patient's consultation information is provided concerning the handling and disposal of hazardous drugs and their related supplies. I believe the language presented in the materials is appropriate and consistent with the board's consumer protection mandate. Members, do you have any questions on 1737.1? Okay, let's go on to public comment.
Thank you, Madam Chair. I am opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Yes, thank you, Tricia.
Okay.
Moving on to 1737.2, list of hazardous drugs. This section establishes requirements for assessment of risks consistent with the standards of the chapter. The draft language also establishes a requirement for a review of the facility's hazardous drug must be reviewed and approved. Also, unlike the provisions in the other articles as proposed in this section, draft language specifies that the designated representative is a single person approved by the PIC. Members, I've reviewed the proposed language and believe it's appropriate. Do you have any questions or comments in this section?
Hi, Maria. This is Renee. Just very, very small is to add an S to the drug. So it's list of hazardous drugs, plural.
What section are you in? I'm sorry, Renee.
1737.2.
Which letter? A?
It's the title.
Oh, the title. Thank you. Okay. Any other comments or questions? Okay, we're ready for public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen or simply raise your hand. And I do see we've got some people who've already typed comment, so hold on a moment. We've got a list here. I'll begin with an attendee identified as Sam. And Sam, you should be able to unmute yourself. There you go. You're unmuted.
Can you guys hear me?
Yes.
Okay. Hi, I'm Sam Martinez from UC San Diego Health. I just had a question about the assessment of risk. As it's written in USP 800, it's kind of vague. So I'm just curious how the Board of Pharmacy plans to review the assessments of risk, because I think it's my understanding from the USP committee that the idea is that the alternative containment strategies are to be equivalent in minimizing exposure. So that, it seems that's kind of subjective, and some sites have just kind of said, well, we don't feel it's hazardous, and that's our assessment. So I'm just curious how the board's going to handle that.
Thank you. I think that the only thing that I could respond is that they could look to USP FAQs. That's out of the purview of the Board of Pharmacy.
All right, the next request for comment is from Marie Kottman. And Marie, I'll let you know when you can unmute yourself. All right, Marie Kottman, you should be able to unmute yourself. There you go, you're unmuted.
Good morning. Did it unmute correctly?
Hi, Marie.
Yes.
Great, excellent. Good morning, board. Thank you for, again, participating in this process. I do think this is a great move for our regulations to be in sync with the USPs. On 1737.2, I would like to recommend that we move section C to section A because it defines the designated person, which is referenced in both A and B. Moving C up to A and A to B and B to C, just a little bit of reorganization so the definition is at the top. The second thing I would like to recommend is the way this is worded right now. My first read through of it was that a PIC could not be the designated person because they had to be approved by the PIC. It may be appropriate to add language, just modify the language in what is currently section C to read, the designated person is a single individual, period. This individual is either the pharmacist in charge or approved by the pharmacist in charge, just to make it clear that the PIC can serve in this role. Thank you very much. I have submitted these comments by paper, but I got them in very late last night.
Thank you.
All right, the next request is from John Gray. And John Gray, you should be able to unmute yourself.
Hi, good morning. This is John Gray. I'm a registered pharmacist with Kaiser Permanente. Thanks for the opportunity to provide comments on this important topic. Before I provide our specific comments on this section, I just want to share our overarching view on the proposed regulations, which will establish requirements in addition to those in USP 800. The committee's stated approach for developing these proposed regulations is to only impose additional requirements that are necessary for public safety. However, the committee has done very little to establish that these additional requirements are actually necessary. Specifically, we would expect a claim that a regulation is necessary to be supported by empirical data. However, such data have not been presented in a public forum for the most part. Furthermore, one instance of bad behavior in one pharmacy that is observed by an inspector is not empirical data. It is a case report at best. It is particularly important that the committee do more to establish the necessity of these requirements because many of the proposed regulations, particularly those related to the physical plant, could be very expensive and very onerous to meet. Our overarching position is that where the committee is proposing to impose requirements that exceed those of the chapter, the committee should show its work and present empirical data to demonstrate that the regulation is truly necessary to protect the public. With respect to this specific section, we raised this issue in the discussion around 797. We believe that the phrase, when the designated person is not a pharmacist, the pharmacist in charge must review all practices related to the operations of the facility that require professional judgment, does not provide the level of clarity that the regulated public requires to implement this requirement. We recommend that the board clarify the specific practices that must be reviewed by the PIC if the designated person is not a pharmacist. One possible approach could be to reference Business and Professions Code 4105, kind of outlining pharmacist duties for practices that must be reviewed by a pharmacist. We also recommend that the board specify the nature of the record that is required to document the PIC's review of practices that require the professional judgment of a pharmacist. Thank you very much for the opportunity to provide comments today.
Thank you.
All right, the next request for comment is from Sean. And Sean, you should be able to unmute yourself. All right, we'll try that again. And Sean, if you see a prompt to unmute yourself, go ahead and click on it. There you go. You're unmuted, Sean.
Bottom. I just had a question with regards to C. It seems as though that's specifying that there could only be one designated person, whereas I believe within USP 800 it does allow for multiple designated persons depending upon the facility or how they're, determining operations.
Thank you. That is the intent.
All right, this is a moderator. I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you.
You're welcome.
Members, do you have any comments following public comment? The only thing that I could suggest is perhaps we do the renumbering of the lettering, but I think that could be something that could be done by myself and by staff and council as we work to harmonize all of the regulations in the different areas. We could certainly renumber or letter them so that the words don't change, but just the order. A good comment. Any other comments on this section, members? Okay. Moving on to 1737.3, types of exposure. The proposed language would require each entity to assure all employees are aware of the types of risks of exposure that may occur. I agree with the language and also suggest that an FAQ may be appropriate to include various types of entities that could be covered. Members, do you have any questions or comments on this section?
Yes, I do. This is Renee. So maybe off of what you just said about defining entity was going to be my question. So here under, so this is Board of Pharmacy regulation. So each entity shall ensure all employees are aware of the types of risks of AT exposures that can occur. So, how is entity being defined in terms of like this regulation? If we're kind of talking about pharmacies, but USP 800 says that, they use the word all the time, right? All entities that, and they go on to list pharmacies, hospitals, other healthcare institutions, patient treatment clinics, physicians' practice facilities, or veterinarians' offices. So will let's say a licensed pharmacy within like a large healthcare organization, is that being applied that way or considered? I'm just not sure. I know there's so many different settings. I'm just not sure what the intent of the word entity is here. And it's going to be for multiple times it's used.
Right, and that's purposeful. So perhaps Anne, Eileen, or Christine or Anna could respond to the legal term entity and how it's being used.
So this is Anne. I would say that there are a number of different settings that this is going to apply to. And so we look at some of our definitions, we're typically calling out professional exist, in the clinics. We're talking about the designated representative in charge that works in the wholesalers, and then of course the PICs. So I think when we look at the language in other sections, we're kind of calling out what those additional environments would be. And I think that that's kind of the intent of the FAQ, is to help people kind of connect these dots through the different provisions of the language.
Mm-hmm. But you're correct. We are the Board of Pharmacy, so these would be licensees that are under our purview. Whereas USP is talking about the larger world. These regulations are about those areas which we have authority.
Okay, yeah. Thank you for clarifying. Thank you, Anne.
Any other comments or questions from members? Okay, I think we're ready for public comment.
Thank you, Madam Chair. I am opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen, or simply raise your hand. We will give you a moment. All
Okay.
right, I see no requests. Shall I close the Q&A panel?
Thank you.
You're welcome.
Moving on to 1737.4, responsibilities of personnel handling hazardous drugs. The proposed language would specify who is responsible for all of the activities and decisions made or approved by the designated person. The language assures that individuals responsible for the overall a page problem here. Let's see. Sorry. Those individuals responsible for the overall operational compliance have a clear understanding that their responsibility extends to hazardous drug handling. I believe the language is appropriate and consistent with our mandate. Members, do you have any comments or questions in this section? I think we're ready for public comment.
Thank you, Madam Chair. I am opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Thank you.
You're welcome.
Section 1737.5, facilities and engineering controls. There are a number of requirements established in this section. As language has been available for quite some time, I'm not going to review all of the language, but do note that the provisions are intended to reduce exposure risks. As an example, Section A requires the need to minimize traffic in the sterile compounding area. There is also provisions in D requiring interlocking pass-through doors have a purge function required by January 1st, 2026. This provides time for facilities to make changes to comply. Also in E, you will note the proposed language includes cross-reference to CETA guidelines similar to the proposed regulations in sterile compounding. Members, I believe the proposed language is appropriate and consistent with our consumer protection mandate. Do you have any questions or comments in this section?
Yes. Hi, this is Renee. So just for some clarifications, so under C, C1, it says HEPA filters shall not be the only means of containment used. And I'm just thinking that for clarity, I know there's, listed under facilities in 800, but like what shall be included versus what shall not happen. I'm not quite sure. I'm assuming that it's implying that it has to be, the room has to be negative pressure, externally vented, have appropriate air changes depending on sterile, non-sterile. But is that what's being referred to here? That might be for Christine.
So Christine or Anna can answer, but my understanding is we're not repeating things that are already in USP. So this was just an added explanation that HEPA filters are not the sole means. But Anna, do you want to clarify? Did we lose Anna? If we did, we have Christine as our backup.
It's Christine. I'm here. So I think the intent of 1737.5C1 is solely to drive home what the chapter says, and the chapter just says that it's not enough, and so that we are requiring whatever it may be for that type of volatile HD without going into every single possibility.
Okay. Thank you. Yeah, I just to clarify on that one. And then
and I'm sorry, Renee, I think for the public to understand that it's really important to know that the regulations that are being proposed in all sections do not stand alone. They are on top of the basic layer of USP. So everyone, and I know you have, I'm not critiquing you because I know you know them, but everyone should have a copy of the USP language and read that first, and then read the California as the additive. Go ahead. Any other comment? I think you had another comment, Renee?
Yes, I did. So, and then just for D, about the pass-throughs. So I feel like it's a little confusing here, like the first sentence and the last.
Okay.
It says where a pass-through is installed in a containment SEC, the doors must be gasketed and interlocking. The last sentence says a pass-through is not allowed between the containment SEC into an unclassified space. So just clarifying, so it's saying, can these be combined, these two sentences? I'm trying to clarify. So, it looks like a pass-through can be contained or installed in a containment SEC as long as it's not into an unclassified space. But if it's a HEPA filter purge type, can it be?
No.
Is that the unclassified space?
No, I see your point. It's a really good point. I think it's because when we were discussing them, we could discuss several different concepts, but there are 3 concepts in D, and the first and the third could be combined into a single sentence or group of sentences at the beginning. And then the last comment is totally separate, is about the purge functionality, and that the purge functionality is something that not everyone has. And so we wanted to give people time to include that functionality. If they have a pass-through now, it should already be gasketed and interlocking, and it should not go to a unclassified space. That's the regulation as was written in USP in their 2019 version. So that should be the standard of practice already. What we're adding is the purge functionality as being the standard starting in 2026. That make more sense if we reword it to explain that better?
Yes, I believe so. And then is this, again, applied to a containment SEC, the HEPA filter purge type? Or is that statement for all? I'm assuming because it's in this regulation, it is for the containment, like hazard negative pressure room, if you will.
Correct. So Christine or Anna, do you think we need to add any more language to make that clear that we're talking about the HEPA purge filter is only for those devices covered under USP 800, or is that understood?
So I think we have some similar language in the 797 regs that we talked about last meeting, and that would apply to that non-HD, the non-segregated SCE. And they're similar, but a little bit different. So there is something that would still be applicable to that type, but Ms. Parker, I do understand how we wrote that kind of confusing. So I'm suggesting we probably take D and make it 2 different sections, because I guess the question then would be, in 2026, when all pass-through doors shall be HEPA purge type pass-throughs vented to an unclassified space, do we really even need the last sentence?
Yeah.
So it's kind of like, okay, what do we need? So we have to go back and do a little bit of work on that so that it's more clear. But I think that when we start by saying containment SCE, I think it's very clear that we would be talking about HD only. Mm-hmm. But if we want to look at what we did when we take this chapter, when we're done, and we look at it for what we did in the 795 and the 797, we can absolutely look at that for the continuity of the 2 chapters, because we've already done that with the first 2. That's a great point.
So what Christine's talking about is after we've discussed today, before the board meeting, we'll be reviewing the language to harmonize. And so that will be presented to the board. We'll have comments from today's meeting, in addition to any grammatical or other kinds of things that need to be changed with review with myself, council, and staff. But I heard from Christine, I thought was a good idea, let's document that here too, is to separate that into a D and an E, and then that would be 2 separate sections, so that it would be clear.
Yeah, thank you.
Any other comments? Renee, have any other comments on this section? Any other comments, Renee? Or she's looking. I can't tell if you're looking or if you're No comments.
I'm looking at the next one.
Okay.
Thank you.
Members, any other comments? Any comments on this section before we open up to the public? Okay, let's move on to public comment for 1737.5.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists, or simply raise your hand. We do have a request for comment from Marie Kottman. And Marie, I'll let you know when you can unmute yourself. All right, Marie, you should be able to unmute yourself. There you go. You're unmuted.
Thank you. Good morning again. Marie Kottman with Pacific Compounding Pharmacy. I'd like to comment on section 1735.5E and 1735.5G. Section E is with regards to room pressure monitoring equipment. I would like to propose that you remove this for the time being, at least, because the CHE 003-2022 is already out of date, as it was approved in October 2022 before USP 797, 795 went into effect, or were even published on November 1st. Secondarily, I did review this 53-page document in an effort to try and find what you were looking for with regards to the room pressure monitoring equipment shall be placed in a specific place. This guideline, I was not able to find where that placement should be. It is not clear searching for several of the terms. The term facility room pressure monitoring equipment is only listed once, and it's in reference to how they test the room to meet the CETA guidelines, not regarding actual placement. So if there is something you're looking for, if you could please rewrite this to tell us what you want, as opposed to putting in an outdated guideline that doesn't seem to have clarity already placed in it. I would love to comply with whatever it is you're looking for there. On 1735.G, the CSTD shall be used when compounding anti-neoplastic HDs when the dosage form allows. We actually do work with several chemotherapy preparations every single day, and there are situations where the dosage form would be amenable to a CTSD, but the CTSD, number one, occasionally fails. Number two, they can be on back order. Number three, sometimes they don't allow for retrieval of all of the HD out of the appropriate vial to get the appropriate dose for the patient in need. So having this as a shall instead of a should is too strong language, because when I run into one of these situations that do arise once or twice a month, then we would not be able to further prepare the preparation for the patient. I'd be out of compliance if I went forward and used the negative pressure techniques that are taught and have been taught for decades on how to use HD, how to prepare HD medications. So I strongly suggest that you do not include a shall be used. If you want to put in stronger language than USP 800, we need to reword this to allow for situations that do arise in actual compounding. Thank you very much for entertaining my comments.
Thank you.
All right, the next request for comment is from Melanie Horn. And Melanie, I'll let you know when you can unmute yourself. All right, Melanie, you should be able to unmute yourself.
Board of Pharmacy. Yes.
I was just going to say you're unmuted.
Thank you. Good morning, Board of Pharmacy. This is Melanie Horn, pharmacist with Sutter Health. Thank you for the opportunity to comment. I wanted to comment on 1737.5 Section C, the term handling. This term is specifically defined in USP as stating includes but is not limited to the receipt, storage, compounding, dispensing, administration, and disposal of sterile and non-sterile products and preparations. My concern regarding handling volatile HDs as the terminology creates some confusion that all of these activities are included under this section as HEPA filters as a containment for use. So what I would propose is the possibility to either reflect if it is specifically talking about the activity of compounding, repackaging, altering or removing the dosage form from its primary container, which would then potentially expose to the volatile HD, if that is what this is in reference to, only because Section C1 creates some confusion for possibly administration or other types of activities. So that was just a comment there. And then I would also request in Section F, containment supplemental engineering controls, CSTD shall not be used to extend in-use time, BUD, or expiration. I was hoping to possibly understand if there would be potentially an FAQ of an example of what this was referencing. There is some opportunity for docking of proprietary medications with a CSTD type device. And this is not to extend the in-use time or the BUD, but I was unsure what this was specifically referring to. So that may be an opportunity for an FAQ to further understand these situations so that we can be in compliance. Thank you for the opportunity to comment.
Thank you.
All right, the next request for comment is from John Gray. John, you should be able to unmute yourself. There you go.
Hi, good morning again. Thank you. Yep, this is John Gray, registered pharmacist with Kaiser Permanente. I just have comments on a few elements of this section. First one is 1737.5A, the requirement around storage of HDs used for non-sterile compounding and not storing those in areas designated for sterile compounding. We just want to point out that there are some facilities, like some hospitals, that might infrequently compound non-sterile hazardous drugs. However, when patient need dictates a compounded non-sterile HD, the facility does need to be ready to prepare it. We do not view it as reasonable to require facilities to build a separate negative pressure room or to install a negative pressure container specific to the storage of non-sterile HDs, just to kind of have contingent storage space available to support the practice I just described. Therefore, we recommend that this requirement be deleted from the regulation. Second, 1737.5C related to handling volatile hazardous drugs. We would just like to point out that there are many kind of disparate sources of information about the characteristics, such as volatility of drugs that are available to the regulated public. As a result, we are concerned that there could be variability in enforcement practices by board inspectors related to how a facility determines and designates a drug as volatile. Therefore, we suggest that the board either develop a list of drugs that are considered volatile for the purposes of this requirement, or identify the specific reference that inspectors will use to identify volatile drugs, so that the regulated public and the board can be on the same page about what is considered volatile. Lastly, 1737.5D, the USP chapter does not place a prohibition on the placement of a pass-through between CSEC and unclassified space. Many responsible and well-meaning organizations have constructed hazardous clean rooms based on the facility requirements listed, in the chapter. And so, we're concerned that specifying this type of requirement, that a pass-through not go from CSEC to unclassified space within the regulation
10 seconds.
Could result in reduced access to compounded drugs for the public if the compounding facilities are temporarily or permanently closed because they do not meet this requirement. Thank you.
All right, the next request for comment is from Sam. And Sam, you should be able to unmute. There you go.
Yes, thank you. This is Sam Martinez again. I just wanted to clarify, I'm a little confused about the whole pass-through thing. So it was crossed out because it says effective January 21st, all pass-through doors shall be a HEPA purge type pass-through to an unclassified space. But then it says you're not allowed to have it to an unclassified space. So are we getting rid of that? And then it got moved up there. So I'm just a little confused.
Take out the unclassified space. Thank you. I'm person who's typing. There's a mistake. Oh, purge type, period. Effective January 1st, 2026. Thank you for pointing that out. All pass-through stores shall be a HEPA purge type. Pass-through, I guess. And we'll work on fixing the words, but the intent is, that's what the intent is. Thank you for pointing out that correction.
And this is the moderator. I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you.
You're welcome.
We had a little bit of robust discussion here, so let me summarize and then ask the members what their thoughts are. First, I heard was in this section D that it may be a good idea to divide it into two sections. The first section talking about what a pass-through is currently allowed, and then what we would like it to be in January 2026, which would be to have the purge function. The second comment that I thought was that we should talk about would be C, and changing the word handling. So we need to work on changing the word handling to be specifically what we want to accomplish here. The third was about F. We need an FAQ. And what was the fourth? From John Gray, A. I'd like to hear from members a little bit more discussion on A. This is a challenging area because for environmental and personnel safety, it's beneficial to have the non-sterile and the sterile be separated. But Dr. Gray pointed out an interesting concept that that has been discussed amongst other people also, and that every once in a while you have hazardous oral tablets or liquid that have no place to be stored other than with the sterile hazardous components. And according to A, that would no longer be acceptable. So members, especially Renee, any comments or questions about that?
Yes, hi, thank you. Yeah, I do believe that that's definitely worth discussing again. Thank you for your comment, John Gray. And, because also if it's not supposed to be stored in a sterile compounding area, but you would have SOPs for bringing supplies into that room because you're storing your sterile HD meds. So those SOPs would apply. That could also be something that can be, possibly, tested during your environmental testing, making sure you're meeting your criteria, adding that type of dynamic condition. But again, as pointed out a lot, I think many places that don't do much in terms of non-sterile HD compounding, they really would not be entering the room very often. So not a lot of disruption. So I think that that's a good point, and creates a hard situation to have to store a small amount of drug in a new space, which is probably prohibitive.
So look at what's on the screen. I think that's an attempt to allow some storage if the SOPs, I think, talk about minimizing traffic, but I would probably put in there minimizing contamination and traffic, because we certainly don't want contaminated non-sterile products contaminating like the refrigerator or the shelf. So what do you think about that, Renee? As a place to start, and then I could discuss it further with council and staff.
Yeah, I believe that, creating an exception, except as defined in the SOPs, that looks like that would help some of the facilities to be able to utilize that, as long as they have that defined. Because if they are using, I'm assuming that a lot of small areas, if they even have hazard compounding for sterile compounding, then they're probably not only storing it there, but they're probably also needing to compound there, which in USP 800 is allowed as long as you do all the cleaning and you show that you maintain your ISO 7 during your compounding. So that is, it helps allow that then.
You will feel my wrath.
Okay, I think somebody else is unmuted that we're hearing like a radio or something.
That's right. Call your mom.
Okay, thank you. Members, any other comments on this section before we move on? We'll bring these suggested changes to the board meeting next week. Okay, let's move on. 1737.6, environmental quality and control. I believe that the language presented is appropriate and consistent with our protection mandate. The language specifies requirements for standard operating procedures to establish provisions for environmental wipe sampling. Further, the proposed SOP includes the minimum action that number be taken when actionable contamination is found. This means that they provide, the SOPs would provide the specifics on the wiping and the response for any actionable contamination. Members, do you have any questions or comments on this section? Okay, let's go on to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, our first request for comment is from John Gray. And John, you should be able to unmute. There you go.
Hi, good morning. Thanks. Good morning again. This is John Gray, registered pharmacist with Kaiser Permanente. Thanks for the discussion on that last piece about storage in the sterile compounding space. Just a couple things on 1737.6 A and B. The proposed regulation reads as though it will allow facilities to specify the frequency with which they perform environmental wipe sampling. And the way I read it, a facility could elect for that frequency of sampling to be that the facility does not routinely perform wipe sampling in the compounding space. If that is the case, then we believe that this regulation provides the appropriate level of flexibility to determine the frequency and nature of wipe sampling that it performs. On B, it reads, the proposed text currently reads, when actionable contamination is found. I would suggest considering modifying that slightly to say something like, when contamination that exceeds the level specified in the entity's SOP is found. I think that's what the current text of A is getting at when it specifies that the SOPs need to speak to actions that are taken when those levels are exceeded. So it might be beneficial to just tie that same actions when those levels are exceeded down into B, where it says when actionable contamination is found, like kind of using the same words. Anyway, that's it on this section. Thank you very much for the opportunity to provide comment.
Thank you. And I think just for a moment here, if we could have Dr. Kalantar or Dr. Acosta comment when we say its frequency, would it be allowable to have none, or a frequency means a periodic type of number versus just saying we don't need it?
Hi, this is Anna. So I believe the intent was to have a frequency. I don't believe no frequency was an option here.
Okay, thank you. I just wanted to clarify. I think we're ready for the next comment.
Thank you, Madam Chair. The next request for comment is from Marie Kottman. And Marie, you should be able to unmute. There you go.
Thank you. Good morning again. Marie Kottman with Pacific Compounding Pharmacy. To answer your question, Dr. Serpa, the 800 is already written to require at least every 6 months sampling. So even if this was in effect and allowed us to choose a different frequency, there's your minimum, is every 6 months. My recommendation, though, is to allow USP 800 to stand on its own and not impose a more restrictive regulation with regards to wipe sampling. USP very clearly states that there are currently no studies demonstrating the effectiveness of a specific number or size of Whipple samples in determining levels of HD contamination. So we're working really completely in the dark. And to have pharmacists try to develop an actionable level that was had any meaning to it at all, to determine whether things were deactivated or cleaned appropriately is very difficult. I agree that a sampling process is appropriate as indicated in USP 800, so I'm not arguing that in any way, shape, or form. However, the experts also say there's articles out there that indicate that sometimes the decontamination process actually will get rid of the agent that you're trying to remove, but you then get a result of a more harmful or more problematic agent by decontaminating from the first one. Further, the data that we get from this is at best a screening tool. It tells us if we have contamination or not, or if our cleaning process is working or not, but it doesn't tell us what the level of risk is to our employees. So in an effort to reflect what Dr. John Gray from Kaiser said earlier today, let's show some evidence as to why and how this should be done prior to just implementing or regulating our licensees to do something that really has no guidelines out there. It will be incredibly difficult to come up with a meaningful program that meets this specific regulation going forward. Thank you.
Thank you.
All right, this is a moderator. I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you.
You're welcome.
So members, I think there's one area that I could go back and discuss further with as we refine the language, and that's would be with B, to harmonize the actionable contamination with how we deal with the regulation with quote unquote actionable in 797. I think we were trying to mirror the types of language, and so I think there's a chance to go back and look at the wording, but I think we have a concept that we want to go forward with. Other than that, members, any comments to finish up with 1737.6? Okay. I think it's appropriate for us to take a short 10-minute break because we will have lunch coming up soon. We had an earlier break that was very short. So let's take a 10-minute break and we'll come back let's make it a little bit longer. We'll come back at 11:05. Welcome everyone, welcome back. Let's take a quick roll call to see if everyone's back. Renee Barker.
Present.
Indira Cameron Banks.
Here.
Sung Oh.
Here.
Ricardo Sanchez. Ricardo.
I'm here. I'm just getting to my button here.
Okay, no problem.
Okay.
Thank you, everyone. We'll continue on. We left off with 1737.7, personal protective equipment, PPE. I believe language as presented is appropriate and consistent with our mandate. The use of PPE is extremely important in protecting staff. There are many provisions in this section that are permissive in USP 800 that the proposed language will make as requirements. As an example, in D, makes requirements specifically related to the removal of PPE. The proposed language in this subsection provides specific information that PPE worn during compounding must be disposed of in a proper waste container while establishing that the SOPs must describe where the donning and doffing can occur. Members, do you have any questions on this section? Okay, I think we're ready for public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen, or simply raise your hand. We'll give you a moment. All right, the first request for comment is from Marie Kottman. And Marie, you should be able to unmute yourself.
Good morning, I'm back again. Wish I could see you guys in person again, but we'll do that another time. With regards to 1737.7, I have submitted some comments to you, and again, I apologize, they went in very late last night, but I respectfully request that you remove the term labeled in this new regulation and change it to 2 pairs of gloves that meet the ASTM D697, et cetera, standard. Meeting the standard is very appropriate, but we've done some research on this because not all gloves that meet the standard actually pay to play with that labeling. The ASTM label is a fee-for-service label that does not indicate any additional testing has been done to the gloves by ASTM specifically. We have actually spoken with Kathy Hooper, who is the ASTM Manager of Rights and Permission, who states that the logo does not indicate that ASTM has conducted any additional testing, but merely that the glove manufacturer has completed and passed certified testing. We are able to get this certified testing in a similar form as a C of A for gloves to demonstrate that they have actually met that standard. So I agree they need to meet the standard, but having that label of ASTM is very restrictive and I believe is going to cause a shortage of chemotherapy gloves, especially as we move into the changing of the outer gloves with each type, which is, I believe, 1735.7C. I respectfully request that we either define or change the term type because that has multiple interpretations. Does it mean that when I'm changing from a 5-FU to a cyclophosphamide, that's a different type, or are both of those chemotherapies and thus the same type? It could be very confusing. If we had to change the gloves after every HD preparation, you could have a sterile compounder go through 20 to 30 pairs of gloves in a single session. So I think that that could be excessive if it's not better defined. Thank you very much.
Thank you.
All right, next we have a request for comment from John Gray. And John, you should be able to unmute.
Thanks very much. This is John Gray, registered pharmacist with Kaiser Permanente. Have a few items we'd like to comment on in this section. The first two we are in lockstep with Dr. Kottman on. So at 1737.7a, as you know, Dr. Kottman expressed it better than I could have, and we completely agree with her suggestion that the language should read 2 pairs of gloves that meet ASTM 6978. This information is available in other places, even if the firm that manufactures the gloves has not paid to place it on their labeling. In addition to a CFA, it could also be found in some cases in the gloves FDA 510K filing. So just strongly encourage the board to take that piece of that comment from Dr. Kottman. Also, could not agree more on 1737.7C. We suggest either the board clarify what it means by the word type, or I think our preference would be for this requirement to be completely deleted. Establishing a requirement for compounders to change outer gloves between each type of HD preparation will result in significant increases in PPE expense, trace waste, and will unnecessarily slow down the compounding process. And we're not aware of any evidence that this practice will in any way enhance patient safety. So our strong preference would be just to get rid of it. 1737.7D states that PPE shall be removed cautiously. In our view, the term "removed cautiously" is a non-specific term and subjective, and will lead to potentially unequal application during inspection process, and we recommend that term be deleted. And then lastly, 1737.7E, the requirement to wear a PAPR when performing certain tasks. The requirement to wear a PAPR when deactivating, decontaminating, cleaning underneath the work surface of the PEC would result in significant changes to pharmacy workflows for many facilities. We request that the committee share the safety data to substantiate this practice, and if no such data exists, then this requirement should be deleted from the regulation. Thank you very much for the opportunity to provide comments.
Thank you.
All right, the next request for comment is from Melanie Horn. And Melanie, you should be able to unmute yourself.
Hi, good morning. This is Melanie Horn, registered pharmacist with Sutter Health. Thank you for the opportunity to comment. I also do want to just support both with Dr. Cotman and Dr. Gray's recommendations, especially in regards to E number 2, wearing a full PAPR for cleaning underneath the work surface. This is something that has been applied in some areas. However, the requirement to do it in all does seem to be very restrictive in order to perform this practice, especially in the event that the possibility is still in a BSC for containment and there are protections. We hope that we can consider revising that language to not make that a requirement. So thank you for the opportunity to comment.
Thank you.
All right, this is the moderator. I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you.
You're welcome.
Okay, we have a few areas in here that I'd like to get some comments from either members or our experts, Doctors Kalantar and Acosta. First one is about labeled to meet on the gloves. That was new information to me that is not a standard that all gloves have marked, that they apply to receive that marking. I know that's many ways how users can determine which gloves to use safely. If the box would either say chemotherapy gloves or it would have the ASTM designation on the box or the package showing the safety for the personnel. So members and supervising inspectors, what are your thoughts about removing the word labeled and just say meet the guidelines? Does that provide enough safety for the users?
Hi, Maria, this is Renee. I do think actually that is a good point that Dr. Cotman brought up. So I've, in my own experience, have found that, especially in the past shortage of so many gloves, that there are chemo-rated gloves, but they do not have on the outer package, ASTM D6978, but they will have inside the, this is for sterile gloves, inside in their packaging, they list the drugs that they have tested, and it can be validated by the manufacturer. And then along with other sterile gloves, that the outer packaging lists the ASTM, but you have to actually search for the drugs that were tested. Mm-hmm. So it is not as obvious as always having that ASTM designation on the outside. So I would say that it could say 2 pairs of gloves. I forgot the word that was suggested, but could say rated to meet ASTM. And I forgot what the suggested word was, or that meet ASTM.
So we could look at updating the language in A and B if, unless Doctors Kalantar and Acosta, do you have any comments? Otherwise, I think that's what we're going to try to work on.
So this is Christine. So I would suggest we change it to 2 pairs of gloves and say the labeling. But the problem that we have is that we'll ask people when we go on an inspection if it's not a box, and most of them have no idea. And so then what ends up happening is the inspector has to go and basically prove whether they meet the standard or not. the idea of this regulation is that the pharmacy already knows that and has the paperwork. So I'm fine with it saying the labeling provided by the glove, which is what Dr. Barker was alluding to, is that some of them do give you that. But the concern is that we do have people sometimes using gloves that aren't necessarily appropriate for the type of chemotherapy they are doing, if that makes sense.
It does say documentation from the manufacturer shall be readily retrievable, because we want to make the onus on the site or the PIC to have that documentation readily retrievable, not only for the inspector, but for their staff. Because it's actually pretty easy, like Renee pointed out, when you have glove shortages, people purchase different things, and those all have to be approved by your designated individual.
I guess I was speaking to A, Maria. Sorry about that. I was speaking to A.
Okay.
Because it being rated to ASTM, everybody just assumes the purchaser verified that. And sometimes we find that it has not been appropriately verified. So the idea is that the end user or somebody within that organization actually has some type of labeling from the manufacturer. If we don't want to require it to be on the package, then there needs to be paperwork like a C of A for anything else that would be purchased showing that those gloves meet that standard.
Okay. I think
does that make sense?
Yes, I think we can work on that language to meet that need. Let's see. I think we need to speak to the issue on D. C, sorry, on C, which is about changing between each type of HD. And I'm glad everyone honed in on the word type, because I had a lot of challenges too with, what is a type of HD? And I think the intent there is that there would be no cross-contamination of one chemotherapy onto the next product that would have a different type of chemotherapy. And the cross-contamination could be on the outside of the container. So members and supervising inspectors, can you speak to maybe the inspectors can speak to the intent, and then maybe we can work on the words different type, because that's just not descriptive enough. I see, is that Christine's hand up?
Yes. Yes. So the intent of this is exactly what you just said. The intent is the type of HD. So yes, the expectation would be if you're doing cyclophosphamide and you want to transfer over to a 5FU, that outer glove needs to be removed. We are seeing large batches of different drugs for different patients, all made in one big hood. And that patient at the very end has had 4 or 5 different types of chemotherapy handled, some of which may not even be a type of chemotherapy that patient is receiving. So the idea is to ensure that we're not doing cross-contamination.
So any ideas, other than an FAQ, different type was not meant to be, what's an alkylating agent versus a different other kind of agent, anti-neoplastics versus other. It was meant to be a specific drug, but also we didn't want it to be, at one point there was discussion that it was too broad and people thought it meant doses. So it doesn't mean that Mary Jane's dose and John's dose, you have to change gloves, because if they're the same drug, you don't.
Right, and we could simply say that between each type, or not each type, each drug, or each HD drug. And we can just simply get it like that. We can work on the verbiage. I understand the concern there, though.
Okay, members, any comments or questions to help us with that?
This is Anna. I think an FAQ would be helpful here, because I'm thinking, like, no matter how we try to change that language, it'll still be a little confusing. Like if we say different HD preparations, that's not very descriptive. And when we say a type, that becomes very broad and subjective. Like, I think FAQs would be very helpful here. That's my personal opinion.
Thank you. The last area I heard interesting comment was E2. And I was very concerned about changing that, because I think the protection of the employee is really important. When you go underneath the work surface, typically that means removing the shielding that's in front of you, like in a BSC, but a containment hood doesn't typically have underneath, but they could. So members and inspectors, I'd be interested to see what you thought about that. Are there exceptions to requiring a PAPR when you are taking the device apart and working underneath the work surface to clean? I see a hand up, Christine, Dr. Acosta.
So this is one of the instances where we really just took what USP had and we made a should, a shall. So, and that's one of the things, but I think they all focused in on the PAPR because it's very expensive to wear a PAPR, but you'll note that the USP and this section actually say chemical cartridge type respirator or a PAPR. So we're not requiring them to actually do a PAPR, but we're allowing a PAPR to be used if that's what the facility actually uses. So they can actually get the face mask. Go ahead.
Yeah, I see that where it says, now that I'm reading it more carefully, and it's very interesting, like all of us, you know, the third and the fourth and the 10th and the 12th time you read it, you see something different. There's a comma there. It says appropriate full face piece, comma, chemical cartridge type respirator or PAPR. So there's 3 choices. Okay, so that seems to be okay. So members, those are the areas that we'll work on to bring back to the board meeting. Any other comments or questions on these or others in section 1737.7? Okay, let's move on to 1737.8. The language provides that the designated person is required to develop the entity's communication plan. This is appropriate and consistent with the board's mandate. Do you have any questions or comments on 1737.8?
Hi, this is Renee. So just about that, for developing the entity's hazard communication program. So again, you know, giving for all the different types of licensed entities, as was discussed in the beginning, using the term entity. So in larger institutions, the overarching for that facility is usually environmental health and safety, which I know is not always the standard everywhere. But I guess what I'm wondering is, because that, you know, that's been my experience, but also how that relates to the requirement to have a hazard communication program. It's very long, but it's required by Title 8, California Code of Regulations, General Industry Safety Orders, Section 5194, Health and Safety Code sections, and, you know, 25500 and 25520. So if those are in place, and that encompasses all the departments, I'm just wondering how this can be harmonized, if you will, with that situation.
That's a good concept, because we did talk about that in most situations that we're familiar with, you know, larger complex institutions. This is not an individual, it's a team. The team may be led by someone from administration. It could be led by someone from environmental services. It could be led by different types of people. But I think the concept that I was trying to address on here was that the designated person who is in the pharmacy or in the area, because it's not necessarily pharmacies, it could be you know, designated representative if it's a wholesaler, or other individuals that we have under our purview, that they be a part of developing that communication plan. And so I'd be interested in how to word that so that that intent was more clear. They don't have to be the leader of it, but they should be instrumental in developing the communication plan because they have a different understanding and expertise. Do you see where I'm going?
Yes, I do. And I think that word responsible,
okay,
then while that is going to be true for maybe, you know, a facility entity, if you will, that does not have it, you know, they're responsible for it, and that they don't have it at this time, even though it's required by Cal OSHA. So it could be responsible for developing or participating in the entity's hazardous communication program, or following. Following sounds slightly passive, but participating. open to suggestions or thoughts. I don't know who but that was the only thing I saw about that. I mean, I realize it does need to have a hazard communication program, but wondering if it also, besides USP 800, I mean, does it need to also address this, at the Cal OSHA hazardous communication program requirement?
Mm-hmm. That's a good point. We could work on the wording unless Dr. Acosta has a comment that maybe we can make it a little easier.
Mm-hmm.
Go ahead.
I'm just wondering if Dr. Barker can send us those codes, because if there's a way for us to utilize what's already in Cal OSHA and to make sure that it would apply broadly, not only to our institutional facilities, it would apply to our retail chains as well. So I'm interested in looking at that code. If you could supply that again so I can write. There's a lot of numbers really quick.
Sure. I know. It was unfortunately so long. So it says Title 8, California Code of Regulations, comma, General Industry Safety Orders, Section 5194, comma, California Health Safety Code Sections 25500 to 25520, comma, and the Department of Toxic Substances Control.
Great. Thank you.
Okay.
Thank you.
Thank you. We'll work on that. Any other member comment for this section? Okay, I think we're ready for public comment on 1737.8.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen, or simply raise your hand. We'll give you a moment. All right, we have John Gray requesting to comment. And John, you should be able to unmute.
Hi, good morning. Again, this is John Gray, registered pharmacist with Kaiser Permanente. Just want to express appreciation for committee member Barker's call out on this section and the overlapping requirements, and the fact that in large facilities there are likely other departments and other individuals who have a role to play, to the extent that the facility may leverage all or part of, say, the OSHA, the facility's OSHA hazardous communication standards. So I think the text on the screen looks like it would capture kind of the recommendation that we had, and I'm sure there'll be some refining, but it looks like y'all are on the right track in terms of what we were going to recommend. So appreciate the discussion on this section. Thank you.
Thank you.
All right, the next request for comment is from Melanie Horn. And Melanie, you should be able to unmute.
Hi, good morning again. This is Melanie Horn from Sutter Health. I also want to just comment that I shared similar concerns as Dr. Barker, and I appreciate the dialogue, and do also feel that the proposal to change the language and modify to include the single person who is a designated person as defined earlier in this regulation be defined as participating in development or be responsible for what the pharmacy compounding chemicals and hazards are in the pharmacy, rather than the broader OSHA communication plan that is a broader team and a large entity. So I definitely also agree that this better falls within what we would be able to accomplish. So thank you for the discussion and considering revision for this. Look forward to seeing the changes.
Thank you.
All right, this is a moderator. I see no further requests for comment. Shall I close the Q&A panel?
Yes, thank you.
You're welcome.
Moving on to section 1737.9, personnel training. I believe the language as presented is appropriate. The proposed language specifies the training requirements and includes a cross-reference to the documentation portion of the article. The language includes that personnel that fail any aspect of training will be required to successfully pass reevaluation in deficient areas before being involved in handling hazardous drugs. Note, we added language to those only directly oversight over personnel and HD compounding up to 14 days to pass reevaluation of their deficient areas. This is a direct result of public comment received in meetings prior regarding non-sterile and sterile compounding. Members, do you have any questions or comments in this section? Okay, I think we're ready for public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Please do, thank you.
Welcome.
1737.10, receiving. The proposed language in subsection A is included as the requirements are necessary to avoid contamination in the event of a spill that occurs during shipping or receiving of an API. The package needs to be appropriately identifiable as a hazardous product. Members, do you have any questions or comments on this section?
Hello, this is Renee. So in here, for having it read shall be received from the supplier, in the FAQ 57, it says that suppliers are not required to ship HDs in impervious plastic. So while we wish it would happen, it's not always under the control of the receiver.
So I'll let Drs. Kalantar and Acosta answer, but we do have control of wholesalers that are shipping within our state. So if they're shipping within our state, they have to follow our regulations. And so that's why it is more stringent, but it's also for public safety and for employee safety. So I see your point. We don't have necessarily ability to enforce it in areas outside of our purview, but those areas inside of our purview, we do. Dr. Acosta or Kalantar, any other comments on that?
This is Anna Kalantar. Yeah, so this is what we talked about. This is for our wholesalers, like to include our wholesalers in this.
Any other? Go ahead.
I guess my question would be, Dr. Barker, is it the term received where you think the burden is being placed on the person getting it? Should we change the verbiage received to shall be, you know what I mean, something else, so that it puts the burden back on the shipper? That's what I'm hearing you say, is that the verbiage is, the onus is on the wrong person.
Yes, because let's say you receive it, let's say somebody, even if the wholesaler is supposed to do that, but somebody, human error, sends it and you open up your container and it's not in plastic. You just received it, and now that goes against what this says. So, yes, they do often arrive like that. I mean, again, I can't speak for all situations. I think we experience a high percentage, if not 100%, but that just depends on the circumstance. I'm just concerned about all experiences. And then for wholesalers to know that this applies to them, because, so it should be sent if it's really meant for the wholesaler.
Okay, thank you. Any other comments on this section? Okay, let's go to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, and we have John Gray requesting to comment. So John, I'll let you know when you can unmute. All right, John, you should be able to unmute.
Hi, thank you very much. John Gray again from Kaiser Permanente. It's almost like, I don't know, Dr. Barker have some telepathic connection today, but we agree with the concern that Dr. Barker flagged about the fact that facilities are not always in control of the manner in which a wholesaler and manufacturer decides to ship a product. And so we completely agree with the discussion around placing the onus on the wholesaler or manufacturer to ship product in a way that the board and the committee desire it to be shipped. It almost feels as though, this requirement may be more appropriately placed elsewhere in Board of Pharmacy regulations, perhaps somewhere in Article 10 of Section, Article 10 of Division 17 of Title 16 of the California Code of Regulations related to drug distributors, rather than in a section of code that is really related to the practices within the pharmacy. But anyway, we'll leave that to board staff and board counsel. Thank you very much for the opportunity to provide comment.
Thank you.
All right, the next request for comment is from Marie Kottman. Marie, you should be able to unmute.
Thank you very much. I really appreciate the discussion that Dr. Barker, Dr. Serpa, and Dr. Acosta had on this, because yes, this does place an undue burden or onus on the pharmacist to enforce regulation upon the shipper, supplier, manufacturer, wholesaler, et cetera. I would recommend that if there's a reference here for pharmacies to receive, that it is that the wholesaler is responsible, the manufacturer is responsible for shipping under these requirements. And there's a whole Article 11 as well in the pharmacy law that regulates wholesalers and manufacturers. And I think it would be very appropriate to put it there on the onus for the folks who actually have control of how it actually gets packaged. So thank you very much. I'm very much in support of your conversation.
Thank you.
All right, the next request for comment is Keith Yoshizuka. And Keith, you should be able to unmute yourself.
California Society of Health System Pharmacists. I think I heard discussion about putting the onus or changing the wording such that says that products shipped from within California. I'm not sure. Anyway, I appreciate the discussion about the materials received in the pharmacy. However, having the materials, if we make a regulation about the materials, HDs being sealed in plastic, that would also, I would imagine, apply to the wholesalers. So when the wholesalers receive a product that's not wrapped in plastic, that would be beyond their control, I would think. Anyway, that's the extent of my comment. Thank you.
Thank you.
All right, the next request for comment is from Marie Kottman.
Oh, I thought Marie commented on this section already.
Oh, I'm sorry. I said Marie. I meant to say I'm getting confused. There's Melanie Horn, the two M's. Sorry. My apologies. Melanie Horn, you should be able to unmute.
That was great, the two M's. Thank you for that. Respectfully, I appreciate to be under the Marie Kottmans of the world. So this is Melanie Horn commenting from Sutter Health. I also just want to mimic and reiterate what has been commented up to now. I also want to just annotate that by continuing to state and received, there is still a burden and onus. And the question becomes, if it is not, we have placed SOPs as an organization to allow us to treat this in a spill management format, have a risk assessment, and be able to get the product that we need timely. And so if we were unable to receive it outside of plastic, we would be asking to possibly ship this back rather than be able to mitigate and provide for our patients. So just wanted to add that additional comment in as you're considering how to revise or reformat or potentially move this onto the onus of the wholesalers and manufacturers. Thank you so much for the opportunity to comment.
Thank you.
All right, this is the moderator. I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you.
You're welcome.
Thank you for the interesting discussion on this, and Dr. Barker who brought it up. And particularly enjoyed the topic, the concepts from Dr. Yoshizuka, who reminded us that these regulations are not solely for pharmacists or for wholesalers and other licensed entities in California. So the wholesalers would be also required to assure that their receipt of product is received in these impervious types of containers. So they are also a receiver in addition to a shipper. So members, any other comments on this section? Okay, moving on. Similarly, this next section is 173711, which is labeling, packing, transport, and disposal. The language incorporates the labeling requirements contained in other sections of pharmacy law to serve as a reminder of the labeling that must be met. Subsection B clarifies the package must be labeled as a hazardous drug on the outside of the packaging. I believe that the language is appropriate and consistent. Members, do you have any questions on this section? Note that it talks about shipping, transport of impervious containers also. Seeing none, let's go to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Thank you, Tricia.
You're welcome.
Maria, this is Renee. Sorry, I just had one very small comment I totally missed in my notes here. It's just actually just a kind of a small edit that they shall be transported in an impervious plastic container.
Thank you.
Thanks.
Thank you. Any other comments on 173711?
This is Anna. I just noticed in the title, instead of packing, it should say packaging.
Thank you. Moving on to 173712, dispensing final dosage form. The proposed language specifies that equipment used must be decontaminated after each use. This is another example where the chapter includes this concept as permissive. I believe the language presented is appropriate and consistent with our protection mandate. Members, do you have any questions on this section? Seeing none, let's go to public comment.
Thank you, Madam Chair. I am opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, we have Marie Kottman requesting to comment. And Marie, you should be able to unmute.
Hello. With regards to the cleaning shall be done, there's a lot of equipment that we use that never comes in contact with the HD or the APIs in any way, shape, or form. For example, an electronic mortar and pestle that we use. There are pieces, there's a spindle, there's a mixing jar that actually do very much come in contact. But the remainder of the device does not come in contact with the HD. And so I'm wondering if we could leave this up to the SOPs of the facility or change it to any equipment that comes into contact with the HD, because it will definitely impact workflow and our ability to service all the patients that need servicing if we have to stop, decontaminate, and clean the rest of the equipment that isn't exposed every single time it's used. Just a consideration to make that more clear for HD exposure. Thank you.
Thank you.
All right, this is the moderator. I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you.
Welcome.
So I'm not familiar with that type of device, Dr. Acosta or Dr. Kalantar. It seems like that would be already covered. Is there anything we need to consider or change? I think that's,
So, yeah, we can talk
I think
about it.
that's-
I'm
yeah, okay.
not familiar with that type of equipment.
Moving on to section 1737.13, compounding. Again, the language in the section makes permissive standards within the chapter requirements in the proposed regulation. It makes the permissive ones the requirements. And I believe that's appropriate. Members, do you have any question or comments in 1737.13? Seeing none, I think we're ready for public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, we have Melanie Horn wishing to comment. And Melanie Horn, just a moment. All right, Melanie, you should be able to unmute yourself.
Hi, thank you. Melanie Horn from Sutter Health. I wanted to comment on 1737.13a. In USP 800, the preparation mat use is a should. And while I recognize the importance of, if it is utilized, having a sterile preparation mat, the additional requirements around the preparation mat being for each different type of HD. We have found in our organization, who we went live with USP 800 type enforcement since 2019, that the use of these mats does not facilitate good decontamination processes of wiping vials, wiping your direct compounding surface, and being able to remove gloves and mats during each compound. It also produces a significant burden to be able to acquire sterile mats. In some of our facilities, we could be using 100+ mats a day because we are not often able to compound chemotherapy for a patient in batches due to scheduling. It could be cyclophosphamide once, and then 5-FU, and then cyclophosphamide again. And these mats would have to be changed throughout this process. We strongly request, we have not encountered any significant problems not utilizing preparation mats. In many of our facilities, we require strong decontamination processes, regular wiping of all of our vials, and we just strongly encourage to continue to allow the use of the preparation mat for situations around spill, and to utilize our cleaning processes in the direct compounding area routinely. We found that the mats can often not be cleaned regularly. And again, just would strongly encourage this to be something that an organization assesses for use and not be required in order to do these compounds. Thank you very much for the opportunity to comment.
Thank you.
All right, next we have a request from Marie Kottman. Marie, you should be able to unmute.
Hi, I'm back again. So I would like to echo Melanie's sentiment on that. I also agree that with workflow within a hood, if you have to change a sterile mat with every different chemotherapy, and it is often difficult to batch them in multiples because of the way the orders come in, that would create a lot more hands going in and out of the hood. It's very disruptive. And having an appropriate SOP for the decontamination and cleaning of your hood should be appropriate in place of using a sterile mat. Further, on section B, I'd like to propose that you take off the end of the sentence and leave it as only one HD drug may be handled in a CPEC at one time, period. The phrase, if making multiple preparations, becomes confusing. Thank you very much.
Thank you.
All right, the next comment request is from John Gray. John, you should be able to unmute.
Hello again, good morning. This is John Gray, registered pharmacist with Kaiser Permanente. First, I want to just echo the sentiment of Drs. Kottman and Horn on the issue of preparation mats. We know of no evidence that indicates that the use of preparation mats in the compounding of hazardous drugs in any way enhances patient safety. This requirement will result in an increase in the cost of care and an increase in the amount of waste entering the waste stream.
between the requirement to use and change a preparation mat and use and change the outer gloves between each type of drug. I hate to imagine the amount of glove wrappers and preparation mat wrappers that will be dumping into the trash and adding to the Great Pacific garbage patch. If the use of preparation mats does not contribute to the overall consumer protection mandate of the board, then we recommend that this requirement be deleted and revert back to the chapter. Second, on 1737.13b, we just want to point out that many modern chemotherapy treatment plans include multiple agents that are administered on the same treatment day. We believe that establishing a requirement that only one HD drug may be handled in the primary engineering control at a time, if making multiple preparations, will be at tension with the nature of modern chemotherapy regimens. We request that the committee provide the empirical evidence that supports this requirement, and if no such evidence exists, then the requirement should be deleted and revert back to the chapter. Thank you very much for the opportunity to provide comment.
Thank you.
All right, I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you. So members and inspectors, first area to discuss is the preparation mats. I think a couple of areas that I could see some improvement here is, first of all, by putting the word disposable, because it's actually not clear on here that it would be a disposable preparation mat. So we needed to add the word disposable. That's the easy part. The other part is, when should a mat be required? And we heard some intriguing comment about using it in the sterile environment. I still believe that this is very important to use in the non-sterile preparation, that there be some sort of mat that's disposable and used in the non-sterile environment. But I'd like to hear your thoughts about both environments and the use of mats.
So I would have to add that my experience in using the mats, and my experience is using them, is again, shortages come up all the time. This one is extremely difficult supply to be sterile. And in that, again, maybe in the future they won't be, but with a big increase, it's just a concern. I'm not, I should say, I do actually support the use of the mats. I know it varies in practices, but in times where if there is, an inadvertent spill, it minimizes the exposure inside the BSC. However, with that said, I also agree that in terms of manipulations on it, if you have, sometimes you can't necessarily see a drop, but now you want to, you're doing sterile compounding, so you're disinfecting your work surface, which is the mat, frequently. So if you have some drug on it, that seems to be at odds a little bit with trying to be safe as well. Even though you will be wearing 2 pairs of chemo gloves, that's always been a concern of mine, is the sterility on top of the mat. So I understand when institutions also don't want to go that route, and can show that they can clean and decontaminate more easily. So I'm not necessarily against having the sterile mat. I just see that it can create, depending on the sterility versus the hazard drug management, can be at odds. And yeah, that's probably what I'm going to say about that.
Well, I'm glad that you see it that way also, because I'm familiar with using the mat, and so I was also very concerned, as just because it's our bias and our history and our standard operating procedure, should that be what goes forward? And I think there's adequate thought that we should not be any lesser than what many institutions already do. So what I'm thinking of is putting the word disposable somewhere in there so it is a disposable preparation mat so people don't end up having some sort of reusable preparation mat in the future. We often worry about unintended consequences of regulation. But I do see that we need to work on the last part of that of A where it says type of HD drug and harmonize that with the other place that we talk about type of HD drug. So that's very clear. That phrase comes up again here. The other area that I wanted to respond to is I would be interested if you had any word changes for B, but it was really important for us to not put a period too early in that sentence because we didn't want the unintended consequence that would be that one dose at a time. If you're making 3, 4, 5 doses of cyclophosphamide, those could be all made in the hood at the same time. It was not one drug, one dose at a time. It was one drug at a time, and that's for the safety of not mixing things up. So I would keep the wording the same. Be interested to see if members have any comments on that also.
I would say that, if that was some public comment and there's some, needs maybe some more clarity, I think that was mentioned earlier somewhere else. So it could be some wording or else, and also a FAQ.
Okay. So we'll work on that. Are we ready to move on, members, to the next section? Good. Moving on to section 1737.14, administering. The proposed language in this section is again ensuring that the hazardous drug is placed in an appropriate container and labeled as hazardous. Further, it ensures that patients and/or their agents will have the appropriate gloves to protect themselves when handling the hazardous drug. I believe the language is appropriate. Members, do you have any comments or questions on this section?
Hi, this is Renee. So for administering, I think there can be many different circumstances. So by having, one location who's compounding, and then to ensure that there's the appropriate gloves and in quantity at a could be much more distant site that you don't have control over. I'm thinking again, my experience as a larger institution, and along with working with under a hazard communication program where other departments are involved, and I guess there would be no way to know that they're there, and probably more likely, it also includes, let's just say it's currently just not stocked. Supposed to be stocked, not stocked. I think that this one would be very difficult to control in some situations where you're not directly right there.
I can understand that, but I think that where USP 800 gets to is that the entity has greater roles and responsibilities. And so part of that hazardous communication team would be involved with assuring that there are adequate waste streams, that you have adequate gowns and protections for nurses or for others, for housekeepers that are cleaning the linens, that the linens go in the correct waste stream. Those are all the things that we in acute care know that are happening. And usually you're informed when there's a problem, but you're not out there, I understand, daily checking it like you are checking your IV room. But I still think that's important that we be aware and be part of the mitigation plan, like we did with all these medication shortages and supply shortages with the pandemic. The teams were brought together to discuss mitigation plans, and the designated individual should be a part of that, is what I'm going towards.
I think in some circumstances, the resolution of a lack of gloves would go towards where the supply comes from. Again, this is just one setting. I'll be curious to know what the public comments are and some suggestions perhaps.
And keep in mind that one thing that's very interesting about here is it also talks about making sure that those that are in home infusion or hospice or even outpatient prescriptions, that they're given the appropriate gloves and education to administer the drug safely in all environments. Hazardous drugs are used in a lot of places. It's really important that everyone be informed. So if we can wordsmith it a little bit, let me know how we can do that better. Any other comments? Okay, let's go to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, Marie Cotman would like to comment, and Marie, you should be able to unmute.
Hi, thank you again. With regards to Section A, I would like to add a clarification because as we do dispense HDs that we do package in impervious plastic containers already, I was concerned that I would have to decontaminate even a new container. So if we could add right before decontaminated, clean or decontaminated, just so that it's, or new or something that indicates that if we're using a brand new, never been contaminated before package, that we don't have to decontaminate it before we send it back out. Secondly, on part B, I kind of agree that we need to wordsmith this. I wish I had language to present to you today, but there's two things that come to mind. Number one is a sufficient supply. Who determines that? If we send out one pair of gloves, is that sufficient? Or do we have to send out a second pair of gloves in case their ring happens to rip it? Or do we have to send out a third pair of gloves because the first person who's supposed to do it needed to go to the bathroom, took their gloves off, and now there's another person? It's just sufficient is really left a little bit vague. And I think that leaving potentially the last sentence that says the gloves shall meet the ASTM standard, if we just put that in the first sentence, there shall be a blank supply of ASTM standard meeting gloves, and put that all together, it might help with the wordsmithing here. Thank you.
Thank you.
All right, our next request for comment is from Melanie Horn. And Melanie, you should be able to unmute.
Hi, this is Melanie Horn. I wanted to just comment on Section B as well regarding the sufficient supply of gloves. I can't speak to this very well, but I am also envisioning scenarios like home infusion processes where they could be sending some supplies of HD drugs, and then also have the additional burden to ensure an adequate supply of ASTM gloves. These are usually separate processes that are associated with home health nursing and other supplies. And so I just am curious regarding how this would be enforceable, and then also what types of things we should prepare in order to be compliant with this in those alternative settings of home health and sending preparations home for, say, an infusion, a 5FU that goes home and is supplied over multiple days or weeks. How many gloves would be expected as that sufficient supply? Thank you so much.
Thank you.
All right, the next request for comment is from Sam. Sam, you should be able to unmute.
Yes, I just had one comment about the Section A. I think we assume we're talking about anti-neoplastic HDs. So I would just suggest that we add the anti-neoplastic.
Thank you.
All right, this is the moderator. I see no further requests for comment. Shall I close the Q&A panel?
Thank you.
You're welcome.
So the last person actually brought up something that was unique and new to me. So I'd be interested in what their inspectors think about A, when it comes to attach and priming all tubing for all HD products, anti-neoplastics only. What's the thought and the intent there?
The intent would be anti-neoplastic HDs, in my opinion.
Is that our intent?
Agreed.
With anti-neoplastics? So thank you to the public comment. We'll make that appropriate adjustment. It's always good to have many eyes looking at these things. We don't want to have any unintended consequences, but again, we will have many times to look at this, and so keep looking at this language. Members, any other comments on 1737.14? Okay, I think it's appropriate now to take our lunch break before we go into something that could be a little bit more discussion. So we'll continue with 1737.15 after our lunch, and let's return at, let's give us a little bit more time. How about we return at 12:50? Does that work for everyone? Does that give everyone enough time?
Sounds good.
Okay, 12:50 we'll return, and we'll continue on with 1737.15. Thank you. Welcome back, everyone. I hope everyone had a nice lunch. Let's start with the attendance or roll call to make sure everyone's back. Renee Barker.
Present.
Indira Cameron Banks. She's not back yet. Sung Oh. I see Sung.
Sure.
Hi. And Ricardo Sanchez. I don't. We'll wait one more minute for Ricardo and for Indira. I don't see Indira on the attendees. Did she, Trisha, is she in the attendees that need to be promoted?
She's not. It looks like she logged off for lunch and has not returned.
Okay, we'll just watch out for her to promote her.
I see her there now.
This is Ricardo. I'm here. Just letting you know.
Thanks, Ricardo. And so I think we're just waiting for Indira to be promoted. I see her.
She's promoted.
Hi, Indira. Are you there?
Hi. Hi. Oh,
Okay, I think we have everyone back. Let's go ahead and get started where we left off. Here. Section 1737.15, deactivation, decontamination, cleaning, and disinfection. You will note that the proposed language in this section is explicitly stating that agents must be used in accordance with manufacturer specifications. You will recall that this was a similar issue in the language in non-sterile and sterile regulations that we were proposing. I believe that the language as presented is appropriate and consistent, and included in this section are concepts contained within the chapter that are currently permissive, but we're making them as a requirement to protect patients and personnel. Members, do you have any questions or comments on 1737.15?
Hi, it's Renee. I just wanted to make a comment. This is probably more directed at USP 800 than us particularly, but I was disappointed in their use of saying wipes only. And I just want to, just for the record, because it's not always wipes that are used to do these activities. It is, low-lint disposable mop heads or pads that are the end of attachments to devices to clean inside the CPEC. So just putting for the record that that somebody wouldn't be held to thinking they can only use what I would consider like wipes or what's called wipers. There are other devices, if you will, that are used. So again, I know that's the language they used, but I feel like it's limiting to what is actually done in practice. And I think the point here is the no spray bottle, which, yes, I agree.
Great, thank you. Any other comments before we move on? Okay, let's go to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen or simply raise your hand. We'll give you a moment. All right, we have Marie Kottman requesting a comment. And Marie, you should be able to unmute.
Thank you. Surprise, surprise, I'm back. Hope you all had a great lunch. With regards to 1737.15, I do not have any disagreement with making the shoulds, the shalls, and those sort of things. I am a little concerned about Part C, decontaminating, deactivating procedures for a final HD product. I am not aware, maybe you have better knowledge than I do on this, that does happen sometimes. I am not aware if my IV bag is of appropriate material to handle my decontamination or my deactivation agents without causing some problem to my preparation. I'm also not comfortable working with the tubing lines and those sort of things and trying to wipe them all down, stretch them, manipulate them, maneuver them, or get any cleaning agents near the junction where I have spiked the bag. I am concerned about contaminating my final product with those preparations that are necessary to do the decontamination, deactivation. And further, deactivate is a term that's very vague. I understand that USP uses it, but it's a scientifically imprecise phrase. To deactivate something, you have to be able to measure what's going on when it is active, or measure something, and then also measure when you've changed it to determine that you were successful in actually stopping some activity. There's no clarity anywhere in USP that I've been able to find describing what it means to inactivate a hazardous drug. There's also no references describing the measures one can use to actually determine if you have successfully achieved deactivation. So to encode this in such a way where we have to deactivate and decontaminate the final HD product, and I'm assuming you're referring to the packaging, so that the HD agent is still effective, it creates confusion and uncertainty and is a very difficult bar to reach. So there's articles out there that talk about deactivation and how sometimes when you deactivate a chemotherapy agent, it becomes more harmful in its deactivated state than it was in the original state. So deactivation of all hazardous, and even USP says, that deactivation of hazardous drugs is not achievable. So this creates a real onerous position for compounding pharmacists who wish to meet all your regulations to actually accomplish it. Thank you.
Thank you.
All right, the next request for comment is from Melanie Horn. Melanie, you should be able to unmute.
Hi, Melanie Horn from Sutter Health, the other M, as I think Tricia mentioned. I also wanted to, I appreciate Dr. Barker's comments in regards to the use of the wipes wetted. I think the intent was a wiping application process and not the actual physical wipe, but I do appreciate the difference in language. So thank you for considering that and bringing that up. Again, with 1737C, the one comment I would make, I do agree with Marie Kottman's statements. There have been studies in regards to the agents that we utilize and its potential penetration. So this is a hard bar to make a must. Additionally, the final HD product, if we are talking about compounds, just the use of the language product versus the preparation or what dosage forms we are intending this. Is this intended for repackaging of bottles that are dispensed in a container, a plastic container? Would that need to be deactivated, decontaminated? In my experience, this process has been around specifically compounding and making sure you do not have those residues present on the outside. But just wanted to point out the use of product in this C. Thank you so much.
Thank you.
All right, I see no further requests for public comment. Shall I close the Q&A panel?
Please do. Thank you. Members, any other comments on this section? Okay. Moving on to 1737-16, spill control. The proposed language in this section is again requiring the entity to address specific items within their SOPs. The approach assures that the entity considered the issue and developed the process to protect employees. I believe the language is appropriate. Members, do you have any comments or questions on this section? Okay, let's go to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We do have a request for comment from Melanie Horn. Melanie, I'll let you know when you can unmute. All right, Melanie, you should be able to unmute.
Hi, thank you. This is Melanie Horn from Sutter Health. I do want to I caught this after we had the discussion in regards to respirators and SOPs and spill. This in 1736-7A, it talks about the use of a full face piece chemical cartridge type respirator, which is actually only one respirator, the comma. It's addressed in another section. And it doesn't talk about any other appropriate respirator that could be utilized. It does say suspected airborne exposure to vapors or gases. I just wonder why we haven't gone to the place of allowing for PAPRs or those other type of vapor exposure type respirators. And then also in the previous sections that refer to respirators, it would be good to address the respirator that was potential to the exposure. So in a compounding pharmacy that never had a vapor inside of its biological safety cabinet, addressing the appropriate respirator for the type of exposure would make a little more sense than the specifics of the type of respirator. Thank you so much for the opportunity to comment.
Thank you.
All right, this is the moderator. I see no further requests for comment. Shall I close the Q&A panel?
Please do, thank you.
You're welcome.
And thank you, Dr. Horn, for pointing out the opportunity to harmonize this section with the other section that talks about the different types of respirators. We'll look at making sure that they are similar, if not the same. Members, any other comments on this section? Okay, moving on to 1737-17, documentation and standard operating procedures. The proposed language in this The proposed language in this section explicitly states that the entity shall follow their SOPs. You will note that the proposed language also requires SOPs in 16 areas. The identified areas are permissive concepts in the chapter. In the interest of safety, however, the proposed language is requiring SOPs to address each of these areas. The proposed language includes a requirement for SOPs to be reviewed at least every 12 months and specifies that the changes in SOPs must be disseminated in writing to the appropriate staff prior to implementation. I believe that this language is appropriate. Members, do you have any comments or questions on this section? Okay, seeing none, let's go to public comment.
Oh, hi, Maria. Sorry.
Oh, sorry.
Slightly delayed here. It's something that just popped out to me now. I guess just for possibly larger facilities, but to be provided in writing, doesn't allow for like electronic access and reading and acknowledgement.
I think that's a kind of a legal discussion. Maybe Anne or the inspectors. I think writing would include all forms of written communication.
I believe so, but we confirm with council. We understand what the policy intent is. We can define the language with council.
So sorry, Anne sounds really far away.
She is far away. You can see her.
Some sort of
Sorry, we're not hearing
I
you.
can't hear you.
Can you
Sorry.
Can you hear me now?
Yeah. Yes.
Yes. So the intent, if we understand what the intent is, which I believe is some sort of written or electronic communication. You're not looking for this to be communicated orally, verbally in some sort of thing, but you want a more formal documented communication. We can work with staff as long as or council, as long as we understand what the concept is and the policy.
Yeah, that sounds agreeable there.
Great, thank you. Any other comments from members? Okay, let's go to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Please do, thank you.
You're welcome.
Our final section is 1737.18, medical surveillance. I believe the language as presented is appropriate. The chapter includes this concept as permissive. I agree that this should be a requirement to protect employees handling hazardous drugs and believe that the proposed language is appropriate. Members, do you have any comments or questions on this final section? Okay, we're ready for public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen or simply raise your hand. We'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Please do, thank you.
You're welcome.
And thank you everyone for your discussion today. In addition to the changes that we discussed, given significant changes that we have made, and with the committee's agreement, I will work with staff to finalize the language. Similar to the regulation text considered in prior meetings, we will work to ensure consistency between the proposed requirements and those proposed in the compounding of non-sterile and sterile preparations and radiopharmaceuticals where appropriate. These changes will be completed prior to the board's consideration of all the regulations for all the sections at next week's meeting, April 2023. That's the full board meeting. Before I move on to the next agenda item, I'd like to thank Supervising Inspectors Acosta, Kalantar, and Pinella Spangler, who have dedicated significant time preparing for and attending these meetings, providing education to us on the USP chapters, and working diligently to develop the regulation text we have all been considering at these meetings. We are extremely fortunate to have subject matter experts that are truly committed to consumer protection. They have put countless hours into preparing the materials for us. Thank you. I'd also like to thank the stakeholders who have attended and participated in the process. Your participation was vital to ensure that we consider all aspects of the issue as part of our decision-making process. I look forward to the discussion next week and hope that the board will be in a position to move all the regulations together into a formal rulemaking process. As a reminder, November 1st is right around the corner, and licensees will benefit greatly from the clarity that we can provide to the upcoming requirements. Thank you all. I think we're all ready to go on to the next agenda item. Agenda item 6, discussion and consideration of proposal to amend Title 16, California Code of Regulations, sections related to compounding of non-sterile and sterile preparations for dispensing by veterinarians for animal patients. I think the screen needs to change. Okay. 6. Thank you. Members, as you recall, during our February discussion on the requirements for non-sterile compounding, we received public comments regarding compounding for animal patients and a request to expand the current provisions. During our discussion at the time, we determined it appropriate to leave the language as currently provided in the law, which specifies that a pharmacy may compound a reasonable quantity sufficient for administration or application to a patient solely in the prescriber's office or furnishing not more than 120-hour supply for veterinary medical practices. Subsequent to this discussion, we received further comments from California Veterinary Association requesting reconsideration. A copy of the letter is included as attachment 4. After reviewing this letter and having an opportunity to confer with staff and receiving information from the board's veterinary expert, who is a veterinarian, I believe it's possible to extend the provisions for non-sterile preparations to a 7-day supply. Further, I believe that the board could establish provisions to allow for a 28-day supply for sterile ophthalmic preparations under specified conditions, including a requirement that such sterile preparations meet the requirements of USP Chapter 797, Section 14.5. Members, the area of veterinary compounding is challenging because the requirements vary from human compounding under federal law. In addition, both veterinary and human medications continue to face national manufacturer shortages impacting patients. Many of the drugs listed in the comment letter that were found to be difficult to obtain are not compounded products, but as a result of the national manufacturing shortages. I believe the comment letter also highlighted the need for additional education in this area, where products could be obtained from manufacturers or potentially be compounded by the veterinarian practice. The meeting materials include 2 areas where I believe it's appropriate to update the language. If there is agreement with the committee, I will work with staff to update the draft language to incorporate these changes for the board meeting next week. Members, I welcome your thoughts on these proposed concepts. So members, this is about the veterinarians. I see Sung's hands up. Hi, Sung.
Hi, I support this, and if you need a motion, more than happy to make a motion.
Thank you. So you moved that we don't have a motion, sorry. We're just going to be updating the motion. It's not going to be a committee motion, it'll be discussed at the board, but you're in agreement with the proposed changes?
Absolutely.
Any other board comment about the proposed changes regarding veterinary practice?
This is
Pharmacy
Renee.
Services, let me clarify. It's not about veterinary practice. Pharmacy services to veterinarians.
Yes, thank you. I mean, after reading all of it, I would also support the change.
Thank you. I think we're ready for public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We are displaying instructions, and I see we have a raised hand from the California Veterinary Medical Association. You should be able to unmute.
Committee members, my name is Dan Baxter, and I'm the Executive Director of the California Veterinary Medical Association. Appreciate your time here today. While it's important to note that the CVMA disagrees with the statement in the committee analysis that the survey results we submitted with our March 9 comment letter disclose the use of compounded drug products in lieu of commercially available products, the bottom line here today is that the CVMA does support the recommended changes set forth at page 3 of the committee report, and we definitely appreciate the committee's consideration of our comment letter in making those recommendations. Thanks a lot.
Thank you.
All right, the next request for comment is from Marie Kottman. Marie, you should be able to unmute.
Thank you again for allowing me to speak before the board. I too am in support of this, and it sounds like it's almost unanimous, if not. But I thought that just from a community compounding pharmacist, that this looks good, and I think it will help serve our patient population of California and the animal world much better. Thank you.
Thank you.
All right, this is moderator. I see no further requests for comment. Shall I close the Q&A panel?
Thank you, Tricia. Yes.
You're welcome.
So I will continue to work with staff to incorporate these comments into our final package that will be presented at the board meeting next week. Thank you. Next agenda item is number 7, discussion and consideration of draft statutory proposal to amend Business and Professions Code 4081 and 4105. I think we're ready for a slide change. Members, you'll recall that during our January meeting, we considered a recommendation from staff to amend Business and Professions Code sections 4081 and 4105 to address the challenges staff are experiencing in obtaining records necessary to evaluate pharmacy operations for compliance with pharmacy law. During our prior discussion, we requested staff to develop statutory language for our consideration. Attachment 5 includes the draft language. I've reviewed the language and believe it is appropriate. Members, if you similarly agree, I think we could offer a recommendation to the board meeting next week. Remember, I do welcome your comments and would entertain a motion if you think we should sponsor such statutory language as presented. So this is in attachment 5.
I had my hand raised, Maria, but I can just speak.
I can't see you. Sorry, son. Go ahead.
No worries. Just I'm more than happy to make a motion to support this. Just confirming that for 4105 change, the strikeout of the acquisition and disposition of dangerous drugs and dangerous devices, is that because is there other section that covers that portion of it? Just wanted to confirm. I probably should know this, but hoping to make sure.
So we're broadening it to be as required by the statute?
I'm sorry, Ann, you're gonna have to scream today.
Sorry, so can you hear me now? Sorry.
Yes.
So we've added in as required by this chapter. So where records are required in the chapter 4105 will be applicable.
Okay, but where does it cover acquisition and disposition of dangerous drugs and dangerous devices?
I believe in 4081.
Okay, can we probably should add that to the meeting material so we're not taking that out, so that it's covered. That's all. But I'm
okay.
Happy to make
additional background information is what you're asking.
Yes.
For?
Yep.
Okay. So we have a motion. Do I have a second?
I will second that. This is Renee.
Okay. With the motion and second, let's go to public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to talk, please type comment using the field in the lower right-hand corner of your screen, or simply raise your hand. We'll give you a moment. All right, we have a request for comment from John Gray. And John, you should be able to unmute.
Hi, good afternoon. This is John Gray, registered pharmacist with Kaiser Permanente. I just have one kind of suggestion for the committee to consider, and that is that if the committee is considering opening up Section 4105 of the Business and Professions Code to some changes, I would encourage the committee and the board to consider whether it would be a benefit to explicitly allow for records, regardless of the form in which they were made, to be maintained solely in an electronic format if it is maintained consistent with the provisions of Business and Professions Code 4070C and California Evidence Code Section 1550 and 1552. That may help facilities with their struggles in trying to maintain records in a paper format that might otherwise be able to be maintained in a non-alterable electronic format. And thanks for the opportunity to provide comment.
All right, I see no further requests for comment. Shall I close the Q&A panel?
Please do. Thank you.
You're welcome.
Serpa.
Yes, Sung?
I would actually, with that comment, may need some legal counsel advice, but I know we don't have one, I believe. But I would love to incorporate that comment into that. Electronic record keeping is allowable in, my understanding it is, but it's not clear black and white. But, and I know you're creeping up there, so go ahead.
Yeah, I would like to
You're quiet again.
If committee's agreeable, I would like the opportunity to confer with the AG's office before we incorporate that type of a change.
Okay, so
I'll further at the board meeting, but I think that would probably give enough time to have more information, and then we could incorporate that as a change at the board meeting to our motion.
So then I will keep my motion, but with a comment that we look at that possibility of record keeping electronically. And then if that is, depending on the staff discussion, if that could be incorporated into the discussion at the full board meeting.
Thank you. And so I'm looking for a second. Oh, Renee seconded? I'm sorry, I didn't hear that.
Yes, I did. I'll second it a second time.
The second time. Oh, wait a minute. We already had the second, and then we already. I'm so far behind. We had public comment. We're ready for the vote, aren't we? Wow. At the end of the meeting, I must get a little bit hypoglycemic, I guess. So we'll call for the vote. Renee Barker.
Yes.
Indira Cameron Banks.
Yes.
Sung Oh.
Yes.
Ricardo Sanchez. Ricardo Sanchez. He must have walked away for a moment, so we'll record him as a no vote.
No, I'm a vote. I'm here. Just got to the button.
And how do you vote?
I vote yes.
Okay, great. And the chair votes yes, motion passes. Thank you. Before I go on to the next one, I wanted probably to explain a little bit about what's going on when Ann comes into the screen here. We do not have a public location for the meeting, but I decided to meet together with Ann and the staff here in the room so that we have one computer that's being used. If we had, we don't have it set up for web broadcasting because it's not a public meeting. So I'm using my computer and actually following the meeting as I would on my own, but we cannot have two audio sessions set up. Otherwise you would hear tremendous feedback. And so that's why we're sharing the same microphone. So appreciate everyone's understanding on that. Agenda item 8, review and discussion of enforcement statistics. The meeting materials included in attachment 6, which is the enforcement statistics. The board has initiated 2,686 investigations and closed 2,376 investigations. Outcomes have varied and included the issuance of 141 letters of admonishment, 766 citations, and referral of 181 cases to the AG's office. I wanted to highlight that last statistic. 181 cases have been referred to the AG's office. I believe that there's some misconception about the board's disciplinary activities, suggesting that the board is always seeking to discipline a license. The data tells us otherwise, and if you note that 181 cases to the AG's office is 7.6% of the investigations. I'd also like to highlight that the board secured 6 interim suspension orders and was granted 8 Penal Code 23 restrictions. In both instances, the board was successful in securing immediate public protection through these actions while disciplinary case process continues. These actions are core to our protection mandate. Investigation timeframes are also included. I wanted to thank the supervising inspectors who've worked hard to reduce the supervisor review time. There continue to be 2 vacancies in this area, so their efforts are commendable. I truly appreciate your efforts. Members, next meeting, which will be in July, we'll review a 3-year comparison of the data that will help us to evaluate for trends. There was one area that I was going to ask staff and maybe Ann to comment on. If you'll note on the statistics awaiting final closure, the April 2023 showed the average days going up to 75 days, which is not consistent with the previous reports. And maybe Ann, you can give us a little bit of information about that, if that's correct.
So we are working on, staff is looking at the data. We have identified one bottleneck that we are working to resolve related to some experts. But we will look to continue to validate that information, and if there are updates, we will provide it at the full board meeting next week.
Great, thank you. So members, do you have any questions or comments on that statistic or any of the statistics? Okay, I think we're ready for public comment.
Thank you, Madam Chair. I'm opening up the Q&A panel. If any member of the public would like to make a comment, please type comment using the field in the lower right-hand corner of the screen, or simply raise your hand. We are displaying instructions and we'll give you a moment. All right, I see no requests for comment. Shall I close the Q&A panel?
Okay, please do. Thank you, Tricia. Thanks for your help today.
Thanks.
Members, before we adjourn for the day, I'd like to remind you that the next meeting for our committee is scheduled July 18th. This meeting will be held in person with members of the public also having the option to participate via WebEx. Our last agenda item is adjournment. Hooray. As we adjourn, I'd like to thank everyone very much for your time and participation today. We've completed significant work to advance consumer protection through our draft regulations for the past several meetings. I look forward to reporting our work during the full board meeting that is next week. I encourage all of you to attend and to participate. We'll review all of the regulations that we've talked about during this last few meetings that we're proposing. Thank you very much and have a great afternoon.
I just wanna say thank you and all the members and all the inspectors and for all the work you guys put in. I know it's been countless hours. I know there's a lot more to come, but just the last few meetings, I know you worked tremendously hard to get everything organized. Thank you, thank you, thank you. Really appreciate it.
Thank you, everyone. Have a great afternoon.